See the agenda? On mine? Thank you. Oh, that's nice.
I'll take a high again.
Microphone class. No, thank you.
If there's no beer, I'll have to start with the second best. It's the March time. Oh. That's in the March time. March, what is it, March, February? No, the water really clear. Oh, my little big digital one. Oh, it's Clear Bay, it's Clear Bay. It probably would have been better if they had thought of a different name. Yeah, agreed. Yeah, they gave up and so did Black Bear. All of them went out of business at the same time. I remember they were at St. Francis. Yep. Well, somebody wants to put that in numbers of people that ran Black Bear because it cost them way too much money to get over to Oak Creek. Oak Creek gave them incentive to come here too. But they spent so much money on that building over there that it's no use.
Testing.
Yeah, that company was.
Are you able to hear me, Frank?
something.
Aye. I'd like to call the meeting to order. Please stand for the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, Jill.
Frank Carini,
Here.
Cheryl Cerniglia. Here. Leah Schreiber Johnson.
Here.
Amy Malat. Here. Mark Verhalen.
Here.
Darren Gabowski.
I know Darren's is remotely in at home.
So if Darren dials in at some point, we'll note that he's joined the meeting.
Okay. Jane Eichhoff.
I'm here. My mic is not working.
Jane's here, but she's having mic problems.
I'm here.
Yeah. Azim.
Here's Darren. Yep.
Thank you.
Thank you, Darren.
You're welcome, Frank.
Sophia Azim. I'm here. And Francine Annabon. Here.
Good evening, everyone. Thank you for attending November 23rd, our school district meeting. We're going to go right into the public meeting input, number 4 on the agenda. And so I do have a couple of people that would like to approach the board. Claire. One second.
Hi, my name is Claire Krugel, and this is my first year at East Middle School. I want to go back to school. I am missing out on so much in middle school. I want to go to dances and meet new friends. I really like my math and advisory teacher, Miss John. I would love to be able to see her every day and in person. Please open our schools. Thank you.
Thank you, Claire. Abby?
Hi, my name is Abby Hodges, and my mental health has been greatly impacted by virtual schooling. I believe we need to go back to school in person as it can benefit a lot of kids, like the special ed and 504 kids who are already struggling to get the help that they need, and now they can't get that because we're not in person. Kids are struggling with mental health, and maybe the levels aren't so high, but maybe that's because kids don't know who to go to, and maybe that the only people that they trust is people in school, and we can't be in school to be talking to our counselors. Going to school is an outlet for a lot of kids to get away from home in bad situations, and we're not having a lot of socialization anymore with people, like maybe people don't have phones or can't connect with people, and that can impact people's mental health greatly. Kids are struggling, and we need to go back to school. Thank you.
Thank you, Abby. Kent?
Hello, thanks for giving us the opportunity to speak. My name is Kent, and I'm an Oak Creek parent and a critical care nurse in a COVID ICU. I've been watching the school board meetings and I have a lot to say. The fact is, kids do get and transmit COVID-19 very readily. The fact is undisputed. 1/4 of the 1 million total cases in children have occurred in the last 3 weeks alone after many schools have returned face-to-face. Many schools that stayed open are now closing, yet you are thinking of opening. The CDC specifically recommends that community burden rate, not school burden rate, be utilized. It identifies a burden rate of 200 as off the charts. The highest risk of transmission in schools, not 350, certainly not 1,859. I want you to know that hospitals and healthcare workers are being crushed by the weight of COVID in our area. My intensive care unit, lost 23 people in 2 weeks, despite the best care and technology available anywhere. Not old, sick people, but people from all walks of life. People that could be you or I, any of our parents, anyone in this room. People that would not have died if not for the unmitigated spread of COVID. We are at or near capacity at all times. Our ICU is full, and as people die, more come in to fill the beds. The 2 largest hospital systems in the Milwaukee area have submitted requests for emergency staffing assistance. We are bearing the brunt of other people's poor decision-making. Unfortunately, so are our kids. Children's is now taking adult patients. Most hospitals have been forced to reduce services again. The largest hospital in Milwaukee recently had minus 40 available beds. This is as bad as it gets, and it should frighten all of us. If you get sick, will you be able to get timely and proper treatment? I hope so. The fact that there is any thought of returning children to school at this time is frightening to me. It's reckless and possibly negligent. Working on the front lines, I feel like a soldier under constant fire from an exponentially increasing enemy. Yes, some of you want to help the enemy by furthering the spread of disease. Please let this sink in. We are being overwhelmed. Completely. Every day I see people dying, struggling to breathe, gasping like fish out of water, breathing 50 times per minute, but still unable to get enough oxygen. I get to know these people personally. They cry, they beg for me to save them, to stay with them, to help them to breathe, but often there's little we can do. Despite our best efforts, they frequently just die, and they're often alone. I've had patients tell me they were infected by grandchildren that got sick at school, and subsequently died. They didn't want me to tell them because they didn't want them to bear the brunt of that, and they shouldn't. Why does this matter to you? Sending kids back now will definitely make things worse. Even if no children get really sick or die, some of their parents, grandparents, or other family members will. We do not live in a bubble. Imagine the emotional toll of that, knowing that you've infected and ultimately killed a beloved family member. Someone mentioned just trying out face-to-face to see what happens. What's the worst that could happen? If there was a little lead in our school pizza, would you serve it to the kids? What if you learned that no kids in Oak Creek had died from lead poisoning, or that most barely even got sick from it? Did that influence your decision? The other parents in the district said, my kids really want the pizza, they need the pizza for their emotional well-being. It sounds ridiculous, doesn't it? I completely agree. COVID-19 is deadly and highly contagious virus with little preference for victims. What if we just start out suggesting please utter disconnect from the gravity and reality of the situation?
Hey, Kent, you got 30 seconds.
Alright. It begs the question whether some of you are paying attention and taking this matter seriously enough. Are you taking cues from science and the medical community, or just going on a hunch? The bottom line, either you're part of the solution or part of the problem. Please don't be part of the problem. Don't make things worse than they already are. Thank you.
Kathy Lesko?
Good evening, everyone. As a society, we are affected by pandemic fatigue, that feeling of wanting this to go away, to return to our normal lives. I see decreasing motivation to comply with safety practices. We must remain vigilant and disciplined. At the White House Coronavirus Task Force press briefing on November 19th, Dr. McCants Katz, Assistant Secretary of Health and Human Services for Mental Health and Substance Use, shared, and I quote, I believe strongly that we need schools to open in communities whose data indicate it's safe to do so, end quote. Asserting that we must follow the data in our community to increase completely. So let's talk about guidelines and data. The CDC has produced recommendations on 3 core indicators to use. They define the highest risk of transmission and schools burden rate as greater than 200. 2 weeks ago, I heard board members mention they were not married to the 350. Now you should be committed to a burden of 200. The third core measure provided by the CDC is the 5 key mitigation strategies. I encourage all of you in the administrative team to review those. I want to call attention to the request of creating individual school burden rates. The following is from the CDC, and I quote, the 2 measures of community burden should be used to assess the incidence and spread of SARS-CoV-2 in the surrounding community and not in schools themselves. Currently, CDC does not recommend using these 4 indicators as measures of burden within the school, end quote. I strongly encourage you to not use a school burden rate for decision making. I have heard community and board members reference mental health concerns as reason to reopen schools. I empathize and I encourage the district to continue to take actions to support the students and families who are struggling right now. Utilize your behavioral health staff and those partner agencies to provide care and support as needed. I am also a nurse. If there is any doubt that our healthcare system is taxed, that our healthcare providers are experiencing burnout, fatigue, and likely headed down a path of PTSD, I can tell you it is real. COVID-19 is not over-dramatized by the media. I wish I could take anyone with doubt, on a walk through our COVID units in the hospital to see the severity of illness. I hope none of you ever have to experience saying goodbye to a loved one through Zoom. That is the reality in our hospitals. And for those that watch the hospital bed numbers and question them, they have no idea the endless hours of planning and shifting resources to split a room to increase capacity or keep patients overnight in a procedural recovery area so folks without COVID can receive their surgery. That's it. Sorry, could I have 20 or 30 more seconds?
Yeah, 20 seconds is fine.
Okay, thanks. Dr. Ryan Westergaard, Chief Medical Officer for the Bureau of Communicable Diseases at DHS, said that our state has surpassed the New York City peaks in April. This vertical pace of COVID spread is impacting capacity at our hospitals. I know we will do everything in our power to increase capacity and care for patients, but it is at a cost. I worry that cost is the healthcare providers themselves. Doctors, nurses, and dozens of other clinical staff it takes to care for a patient. Who will fill those gaps as those heroes become quarantined and or infected? There is no more help coming. We cannot fast track a 2, a 4, a 6, or an 8-year degree. Would you want someone without the knowledge and education caring for you? There is a finite number of staff available to care for patients. Now is not the time to be reckless and gather in large groups, especially schools. Don't get me wrong, I want my kids in schools. School is essential. While the community spread...
It's past 20.
I'm sorry, I have two sentences. While the community spread remains at an off-the-charts, critically high number, virtual learning is a viable option until the criteria is met for safe reopening. Do the right thing, follow appropriate guidelines, be patient, and keep our kids, teachers, staff, community, and region safe. Thank you, and thanks for giving me the time, Frank.
Michelle?
Right. Here I am again. Since the 2 weeks have passed, I wanted to bring you up to date on what's happening at the school districts around us, which continue to switch to virtual formats. The Franklin Health Department actually issued a cease and desist order against its very own school district, directing the Franklin High School of COVID all activities. The Franklin Health Department will impose fines and penalties for anyone violating the prohibition. The Franklin High School currently remains closed, missing their projected reopening date, which was supposed to be today. The Racine Health Department issued an order closing all private K-12 school buildings beginning next Monday, November 27th. The Cudahy School District announced that it's pivoting its high school to virtual beginning today. The South Milwaukee School District announced that all in-person activities, including special ed, have ceased, and teachers are now directed to work from home. The Kenosha Unified School District voted unanimously to return all schools to virtual following a class action grievance by the teachers union. The teachers union has alleged over 300 safety violations, which have been elevated to the Kenosha County Health Director. The Wauwatosa School District is abandoning their hybrid model and pivoting to virtual due to a surge in cases. The local Oak Creek burn rate now stands at 1,859. With our schools virtual, we still have 31 positive COVID cases. I just received another letter about East Middle School this afternoon, and we have 252 active quarantines. Yet again, we sit here, proposing to throw open the doors and see what happens. We all know what happens. All we have to do is look at Franklin or Kenosha. Anyone can open a school. That's easy.
Keeping the school open is the hard part. The real work comes in keeping, our students, our teachers, and our community safe. We can't have kids crowded into classrooms. We can't have kids sharing the same seat on the school bus. We can't have crowded hallways. We can't have kids eating in lunchrooms together. This isn't hard, folks. All you keep proposing is, let's just open. It doesn't work. Look at the districts around us. They're following an individual school model. Their health department is now proposing fines if they violate and reopen. It doesn't work. For the 3 board members who want to take the quick and easy route, you will ultimately satisfy no one because you can't keep the school open. Right now, you have 9 staff members COVID positive and another 48 in quarantine. If these are 57 teachers, you won't function in an in-person environment. You can't do it. As you know, there are many families who changed from Edmentum to this. We elected this. You can't just now violate the agreement that we have. Thank you.
Danielle? Or Daniel?
Must be Dan. All right. Good evening, everybody. Oh, my clock's already ticking. Okay. I'm speaking to you on behalf of my wife. She wrote this message, but she actually does not like public speaking very much, so I will paraphrase in her own words. I've been a medical technologist at Frederick Hospital Laboratory for over 14 years. I have a degree in medical technology, which includes extensive microbiology and virology training. My lab is performing the majority of the state's COVID tests at this point. The amount of strain and stress on our healthcare workers is immense. We're running thousands of COVID PCR tests a day, over 500,000 tests in total since the start of the pandemic. I call critical lab results daily on COVID patients who are seriously struggling with their health, sometimes they're near death. But it's not only physically draining work, but also mentally draining as I think about these patients long after my shift ends. On top of already running the lab with short staff, we're now dealing with the effects of additional staff being out as they test positive for COVID themselves. We're running more tests with less than ideal staffing, and healthcare workers are burning out fast with no end in sight. This message is being delivered to you on Public Health. Thank you, Dave, just for the record. This does not even take into account long-term effects on COVID-recovered patients. The current shortage of blood products make it harder for other non-COVID patients to get their treatments, including cancer patients going through chemotherapy or patients who are unable to get their surgeries performed. I don't know how much more the healthcare system can handle. The hospital that is between Franklin and Oak Creek, just south of Bryan Road, is struggling majorly. They have run out of room to treat COVID patients, and now they have to treat and house patients in outpatient facilities. ER doctors are seeing patients in the waiting room because they have no place for them to triage anymore. Healthcare workers are putting in extensive overtime. I fear it's only going to get worse after the holidays because people are not hearing us and they're widely ignoring public health experts. The least we can do right now for our healthcare workers is to show that we care for all that they do. They're putting their lives on the line, working hard to care for people, and we can help them by not letting these numbers get worse. By keeping our kids home, we can help lessen the spread for our community and keep groups of people small so hospitals are not overrun. For anyone wanting schools to open, people that continue to go to the restaurants, having large parties, going to junior balls, having meetings in large spaces inside with lots of attendance, thinking that this is somehow a political agenda. Please, it is not. Go sign up, help somebody on the COVID floor, call in the critical labs to the nurses on patients who are failing, work the overtime hours healthcare workers are putting in on top of their normal hours. We're losing time, healthcare workers are losing time with their own families while they work on the front lines to care for all members of our community. The current situation is so bad that the health department in Oak Creek cannot even do their contact tracing properly anymore. When schools were open at my son's elementary school, there was no way to possibly keep appropriate distance in the classroom. There were not enough desks in his classroom, and in his class of 23 students, he had to share a desk with a tape mark down the middle to indicate social distancing of a desk that was 3 feet wide, even though the distance was supposed to be 6 feet. This is not in compliance with the original opening guidelines, and there are other violations as well. Students taught in cohorts, but then going back on a bus where students are mixed. Schools and teachers do not have the means or proper equipment to deal with this pandemic. The least we can do right now is work as a community to get the numbers down below the 350 threshold that was decided on with input from our health experts. Please, you see members from our community here who care for our well-being and our health. Please wear your masks, do social distancing, and help keep our kids get back to school when it is safe. Thank you for your time.
Mindy?
I'd like to thank you guys for the opportunity to speak tonight. So if I screw up my words a little bit, it's because I've been up for approximately 36 hours so far. I am a registered nurse, and I also have a doctorate in molecular biology and have taught courses in biology, microbiology, molecular biology, as well as nursing. So I know a thing or two about the infection process and viruses. I work a couple of 12-hour night shifts a week at a Milwaukee hospital. After my weekday night shifts, I come home to try to help my children with their virtual education. Some days, like today, I might have to go 36 hours with no sleep at all. So I understand those of you who are struggling with virtual teaching. You're tired and you're emotionally at your limit. I get it. This sucks. But where I may differ from you is that I have insight into both how COVID is spread and the way it can affect the body from my background. I have seen how people can unknowingly be carriers of this virus and spread it to everyone around them, putting those who are most vulnerable in danger. Studies have shown that children are very frequently just this type of carrier. It would be easier if I could say that children didn't get this, but anyone who thinks that is grossly misinformed. What happens is that for every symptomatic child with COVID, there are probably at least 6 more who we do not realize have it and are actively spreading it. This is a significant problem. So first of all, I want to personally thank everyone on the board who made the difficult choice of going virtual last time. I know this was not an easy choice, and I know you probably lost people, and that some of you are even being harassed and threatened because of that decision. I know that you did the right thing, and that the correct path is to stay virtual right now. Most people do not have the space to socially distance, and we also do not have the staff to keep the kids in school once the infection rates further elevate, which they will. So this is what's happening. The rates keep going up, especially when people in the community are refusing to socially distance. They're refusing to wear masks. It's the fault of the people who are refusing to do this that I'm stuck at home with my kids, that other people are stuck at home with our kids. I want my kids to go to school. I want nothing more. But I don't want to jeopardize anyone else's safety or my children's safety just because of that. So if you truly want us to go back to school, then you need to start taking this seriously. Socially distance, stay home. If you have to go out, wear a mask. We should not go back to face-to-face until the burden level goes down to an acceptable level. It's not an opinion. This is what the medical community says. Thank you.
All right, thank you everyone for your input. We're going to reconvene after this. Anybody else wants to address the board into our informational items?
I will add for anybody in the room there that we have a number of other informational items tonight. So if you, for example, wanted to go home and watch from home, you can stream this meeting at this point if you'd like to. We're talking 1920 ACT Advanced Placement Update, which will take a chunk of time, followed by an update on weather closings, which will take some time, SEL and mental health, and October budget report before we get to action items. So if anybody wants to transition their location, you got some time here.
I have 2 more speakers. I will go ahead and sit for you right now.
Sounds good.
Janet?
Yeah.
You go first.
Want to go first?
Go ahead.
All right, I will go first. Julie and Melanie. I emailed you a lot of this. I am also a nurse, and I do understand the gravity of this situation. But I do also pay very close attention to research, and I noticed that this actually stated very succinctly that schools should be open, and in fact said that schools are one of the safest places that children can be. They also said that the decision to reopen schools should be based on data and not emotion. And all I'm hearing tonight is very, very emotional speakers, and I understand it. I do, but there are ways that we can do this safely for our children. I consider the CDC to be a very reliable source of information. They were very honest in the spring and said that we just don't know, we don't have data. We have data now. And the CDC I'm not sure if anybody else here didn't see that, but they actually said that schools should be open. We need to be working collaboratively to find ways to get children back into the classroom. This school board's job is not to protect the entire city and state and world from COVID. COVID is here, it's not going away. This is our job, is to look for ways that we can look out for the best interests of our students. Their emotional needs, their psychological needs, their physical needs. And being at home, unfortunately, is not the best and safest option for a lot of our families. Thank you.
Jennifer?
Hi, so here I'm here again. As other people have mentioned that they are coming up and speaking at every board meeting. And actually, I normally have a very well prepared speech, but I don't, because now I need to talk off of the motion. And since several people have given their resume, I work for the state of Wisconsin with Department of Health and Human Services. What my role is I work for the Division of Quality Insurance. I go into nursing homes. And talk about driving up the burden rate. Right now, the nursing homes are driving up our rate. I just came from a facility today that has 53 residents out of a census of 91 tested COVID positive. So I understand the seriousness of COVID. I take it very seriously. I wear a mask, I social distance, and my role is to protect the most vulnerable. Our children are most vulnerable in my eyes, not when I see nursing home residents as the most vulnerable. Now, you listen to my daughter speak. You have heard me speak about her at every single meeting. The mental health needs to be taken more seriously. That's just the bottom line. I asked in my email to you, which I am very blunt and very matter of fact. I don't perceive myself as being harassing. As a matter of fact, I pretty much open my emails by saying I decompress after every meeting so I can say it in the most respectful way. But here's the thing. One of you brought up a task force that goes out to check on the most at-risk students in Oak Creek. I asked her feedback about that. Who was this task force? Who's going out? Because nobody has come to my house. I've talked to educators about this in the Oak Creek School District. Nobody knows what I'm talking about. I think the biggest frustration with parents getting their kids back to school is there's no plan. This school shut down last March. You've had since March to start formulating Plan A, Plan B, Plan C. There's no plan. None. We're back here again, November 23rd. No plan. That's the biggest frustration. Thank you.
Chris, is there anybody else?
That is it this evening.
Thank you, sir. Again, thank you for everyone for your input. Really appreciate it. Reconvene to formal meeting. We're going right to information items. Number 5, the 2019-20 ACT placement update.
Thank you, Frank. We have a couple of guests tonight. So John Krenick and Principal Mongan are joining us to walk through this document.
Good evening. Andy, can you pull up the PowerPoint, please? So this presentation is going to look a little bit different than years previous due to the fact that we didn't have forward testing last spring due to school closure. And we have the 1920 ACT results that we'll go through, and then the 1819 AP results. Keep in mind that some of the data that we'll be going through, we do not have surrounding districts data for ACT. DPI has not released that information yet. So we do not have comparative data, but we do have 3 years worth of our ACT data that we'll go through with you and answer any questions that you may have. So with that I'm going to turn it over to Ms. Mongan, who will walk us through the 2019-2020 ACT and 1819 AP results.
Good evening. We're going to spend a few minutes talking a little bit about ACT to begin with from the 1920 school year. So these results are basically about our current senior class. So the first slide that you'll see, as you probably recall, all 11th grade students are required to take the ACT. You'll notice on the slide that ACT creates career-ready benchmark scores that are statewide. Those are embedded in our personal framework for Oak Creek, specifically routes 2 and 4. You'll notice them cited, as well as the Distinguished Achievement Designation category. These are reviewed annually when we receive our results and part of our school improvement plan, so that we're able to see how many students are shifting from one route to another. All students take reading, math, English, science, and writing as part of this test. And then you'll also see later on in this presentation that during the process of our school improvement planning in the summer, we take some of the areas and revisit our growth spaces and work to achieve our school improvement goals. This year's test date will be March 9th, 2021. All 11th grade students will take it in person, as this is the only option. Students will complete the test online, but they are prohibited to take it home, and I'm sure you'll hear from us again before that date actually comes to us. So we'll stick with the data for this presentation. The next slide shows the same set of benchmarks, and we examine the percentage of Oak Creek High School students who meet these markers. So as you can see, our current 12th grade students took a slight dip last year with the exception of science. We continue to monitor this data to determine trends, facilitate staff development, and develop school improvement goals to address any deficit areas. Normally what we would do is we would look for a 3-year trend before we would do something drastically different. Each class has its own strengths and growth areas. So those are things that we're always looking for when we take a look at this type of data. As Mr. Krennick said, we normally would be able to look at data from the surrounding areas. DPI decided that for now they're not going to publish any ACT data because they have not settled on whether or not to include voucher students. So we do not have comparable data as of yet. The next slide is pretty much the same information, only you will see the Oak Creek averages in blue, orange, and gray, which denotes the school year, while the ACT College and Career Ready benchmarks is shaded in green behind it. Again, you'll see the same trend as previous slides. Moving into AP results, we have a couple of slides related to the 18-19 data. College Board has a 1-year lag when they report their data, so we're looking 2 years prior to that. It's important for us to track the percentage or number of students taking AP exams. As you know, depending on college, universities' acceptance and admission policies, students, when they pass with a 3, 4, or 5, will often be able to obtain college credit while they are still in high school. You'll notice a slight drop in participation percentages during the 18-19 school year. This is the first year students were given a choice as to whether or not they wanted to take the AP exam, or if they felt that the course itself was enough to prepare them for their next step of their post secondary planning. Each district does have their own set of criteria, so data will look different. For example, some districts cover the entire cost of AP exams. That will influence students' participation rates. Some districts will require every student to take it, others give choices. So again, those numbers look a little bit different depending on the district itself. The next slide, despite the decrease in number of students taking the exam, the students who did take the exam performed closer to the state average than in years past. One of our goals is to not only meet but outscore the state in all content areas. That's something that, again, we review during our school improvement planning process during the summer. These next few years, our data might look a little skewed. Not only did we give students the choice to take the exam, but then last year was our first year during the pandemic where students were attempting to take these tests virtually, and this year is still a little bit up in the air as we move towards May. But again, College Board is a really nice resource for us because they provide each teacher with not only a list of students and what they scored, but they also give them a nice set of specific strategies that can be used for some of the areas that maybe our students didn't score well enough in. In addition, quite a few of our advanced placement teachers take advantage of scoring some of the AP exams, so they will score an exam from New Jersey and Texas, and they'll be able to see what different students from different areas are writing and reading and reporting, and then they'll have a better sense of how our students are writing and reading and reporting in these exams. So those type of opportunities are very helpful. And speaking with quite a few of the advanced placement teachers, they've been extremely satisfied and have noted that this is one of the largest professional development opportunities that they've been a part of. So we're excited about that as well. Questions for Mr. Krennick or I on either of these data sets?
Hi, Ms. Mongan, Darren Grabowski. I was just wondering, why wasn't school the year 1920 added to that? That's like 1819, and 1920 is not added to this graph.
DPI is a year behind. There's always a year lag. So as soon as we get the 1920 results, those will be presented. Last year when we presented, it was 1718. So DPI is always 1 year. There's a 1 year lag.
All right, thanks, John.
Is there any particular subject matter that maybe doesn't perform as well, or we don't get as many kids taking the AP exams, or?
Holistically, we are taking a look at our English, ELA, and math. And that is because we don't just pull advanced placement when we review school improvement data. We take a look at how students perform on the ACT, how they perform on the forward exam, and quite a few other benchmarks. And we decided that reading in and of itself and comprehension assists with students regardless of any content area. And so that is one of the reasons that we worked really diligently, and district office was very supportive in creating a position for our learning coach in the area of literacy. And we've had some phenomenal professional development opportunities and resources that teachers have been able to grab a hold of, especially since we are virtual this year. And that really will help us as we move forward with our next set of goals.
Okay, that's good information, so I appreciate that. I was more looking at, I know we have AP classes in computer science, we have them in English, we have them in math. Was there any particular subject area that that we saw like a definite lag or whatever? Does that make sense? I don't know if I'm saying it right.
Sure. There's always going to be a benchmark that's set a little bit lower. For example, AP Physics is an exam that students don't necessarily nationwide score as well in as something like AP Stats. So you'll see students perform probably lower than what you normally would see in an AP Lit type of format. Again, we take a look at the scores not just for 1 year, but for 3 years at a time to see if there are any trends. And then we determine from there what needs to be done.
Okay, thank you.
Mm-hmm.
Candace, have you heard anything, or John, from College Board as it pertains to changes they make? I know personally my daughter last year had to retake 2 of the AP exams because they had issues with submission. Anticipating that someone may have to take AP exams again, virtually. Have they made any adjustments to the process so that things like that don't happen again?
I have not heard of anything directly, Jane. I know when that was happening, it was not just happening in Oak Creek, but it was happening not only in Wisconsin, but nationwide as students took AP courses. So hopefully on their tech side that they worked to resolve those issues. As I stated, it wasn't just a local or a state issue, it was a national issue.
Okay, thanks.
Hey, Candace, you're a visual guy, so looking at this quick and obviously looking at home, I just want to research a little bit more. Is it okay to call you later down the next week or so to have a conversation with you on this?
Absolutely.
Thank you.
Okay. Thank you very much, John and Candace. We appreciate you joining us here tonight.
Thank you.
Thank you.
Okay, next on the agenda is update of policy 253-1, procedures for weather closings and delays.
So we're going to hear from Mr. Krennick again on this one. This is something we've had a chance to take a look at, given all of our work with remote learning lately.
So we have the procedure for weather closing and delays, and something that is being proposed is if we were to have a future weather delay or closing, we could possibly pivot to remote learning so that they would not have to be made up later in the school year, generally at the end of the school year. So I've outlined that and it really stems from all the experience we've had with implementing remote learning and teachers being able to provide synchronous and asynchronous lessons. While it does not replace in-person learning, it is an option if we have 4 or 5 cold days or snow days, whatever that may be, to maybe use one of those days as a remote day so that it would not have to be made up. And if you could scroll down, please, to the procedure. Should say draft, yeah. And if you could scroll down all the way to the bottom, Andy. Right in yellow, this is what is being proposed if or when teachers or administrators are not allowed to work due to inclement weather, but provide remote learning instruction. The school day will be counted as an instructional day and will not need to be made up on an alternate day. So it is in there in the policy if the board chooses to, take action on this and approve it. It would be in the updated policy if needed. If we decide not to use it, we don't have to use it, but it would be there in place in the event that we were interested in pivoting to a remote day due to closing.
John, Frank, this is Frank. If I'm reading this right, the staff would still have to report.
Well, yes and no. I mean, if it's a cold day, maybe not. I'm sorry, if a cold day, they could probably go on, but if we get, let's say, 12 to 14 inches of snow, they could possibly work remotely from home, providing that synchronous lesson. I guess it's dependent on the circumstance.
This is Cheryl. Wondering too, what about, and if it's in here and I missed it, I apologize. What about, how do we account for families that maybe don't have the technology? I mean, I know our kids do now. So are we just assuming that because they have it now, everybody will be okay?
Yes, we are a one-to-one district with technology. Okay. Families that need hotspots, those have been supplied to our families. So as of now, remote learning is going relatively smooth as far as technology sides of things go.
Do you anticipate any weather-related outages for the technology part of it? You know, the snow gets on your dish and, you can't, if you're, I mean, I know dish is for cable, but, I don't know if it, and again, I'm not tech savvy. I don't know if your internet is coming through that way too, or.
No, I understand the question. If there's outage of, electricity or something like that. Again, the policy's in place in case we had to pivot to it. If there was a power outage of any sort, we wouldn't be able to implement this plan because, to your point, Cheryl, students would not have access to the internet or things like that.
Right. Okay.
But my concern would be that we don't always know in advance when a snowstorm is going to hit. And so how do you plan and make sure your kids have all taken home their Chromebooks and
we face some challenges very similar to what other districts who have done this for years have done, and we would try to learn from them too. Part of it would be, like, if we're anticipating major snowfall, and I will speak to my time as a high school teacher and administrator, like that is all that's being discussed, like in the building when there's a huge snowstorm coming. And I see two other former school administrators nodding their head. Like, we'd have to be on the ball and say, everybody take all your stuff home, take your boots home, take your Chromebooks home. We'd know an IC in other years other than this, like who has Wi-Fi issues that Mr. Krennic spoke to a few minutes ago. And part of the announcement, like when I'm on the phone call with the National Weather Service at 3:00 in the morning, and when we make the decision by 4:30 or 4 or whenever the call is made in the region, then I call the communications officer, and all the communications go out through the whole district to the news media onto the website. And instead of saying today's a snow day, it would be the day is closed on account of inclement weather. It's a remote learning day. Please log on in accord with the remote learning schedule. And we have to share it like that. So this is logistically more challenging than a snow day, right? And there are some obvious hurdles. Cheryl mentions access issues, plus people love snow days, and this is right. So it's logistically more challenging than saying today is a snow day. We'll see you all tomorrow. There's a lot more moving parts here. Like when we talked about a cold day versus a inclement weather day, people reporting, clearing the lots, like there's a lot more communication involved in here, and we'd have to be pretty on the ball to execute this, but it's not insurmountable. Some of our neighbors have done it for a year or two now, and we have the infrastructure in place at this point. So that's why we asked John to bring it to you today.
So Dan and John, real quick. So say it happens, they go virtual for that day. Now, like I believe Cheryl said, they forget it at home with a Chromebook or something. Would they get marked truant or absent for that day, even though they're not on their virtual learning with the school and the class because they don't have their Chromebook, or they just like thinking it's a snow day, I don't have to sign into nothing? And then would they do robocalls also to the phones to let the parents and students know that, and like Dan said, 4 in the morning, 4:30 in the morning, would they do a robocall also besides notifying the news media?
So to the first part, we have a policy for remote learning, and it looks a little bit different than in-person learning. We would implement that, and that basically if students log in and participate, and or if they're not able to complete lessons or assignments, they would be considered present. The second part of the question was about communication, and I can let Dan speak more to that than me. When that is called, Infinite Campus does send out a message to parents and families. It's posted on the website. So yes, it is communicated, and in most cases, as Dan said, is if there's a storm coming, or really cold weather like we had 2 winters ago, we knew we were going to be closed for 2 or 3 days due to the cold weather, the polar vortex. I think that's a situation where we could plan ahead of time knowing that this is coming.
So to the question about communication, Darren, we would use the exact same methods and modes for communication that we have for years. Infinite Campus, like John mentions, the news media, the website, the difference would functionally be, instead of saying today is closed on account of inclement weather, it would say today is closed on account of inclement weather. Please log on at your designated time for a remote learning day. That'd be the primary difference.
Okay, I understand all that. I know all about that. I have children that went to the district.
Yep.
One presently. It still doesn't answer my question. Will there be a mobile phone call or a text message? You're saying that the internet and all that other stuff.
Yes,
I understand all that. You never said yes to the
answer to your question is yes.
Okay, thank you.
Same as always.
Thank you.
You're welcome.
If this is something that we decided to adopt, is it an all or none? So if there happen to be 3 snow days a year, would we then always pivot to remote learning for those days, or would there be some rationale for doing it on a case-by-case basis?
I think the second, a case-by-case basis. How I look at this is like an insurance policy. Like, if we need to use it, we have it. Hopefully, we won't have to use it. But it is in place in the event of, really extreme cold weather. They're predicting 50 below temperatures or 40 below zero temperatures for 2 days. We know that ahead of time. We could implement the remote learning for inclement weather, but it would be on a case-by-case basis. We are not tied to this by any means, but it would be in the policy if we do choose to implement it.
As an option, okay.
As an option.
Part of it, why that gets to a point that was made by board members earlier, like if it's a very surprising incident, like if it comes out of left field and we know, or it's an ice storm like we've had in prior years where we know we're going to have major infrastructure issues, or we didn't give people enough warning to take home all their Chromebooks. Like, it's like a lot of other things we've dealt with recently. You're forecasting a little bit. You're looking into the crystal ball. So I can see moments where we would be ideally situated. A storm's been coming for days. Snowpocalypse graphics on Channel 6, right? Everybody's talking about it. We're ready, versus something that's just a much more acute issue. So,
one thing I'd like to bring up to the board is, if we're still virtual and it's a snow day, I would like to say that we still not go virtual and let the kids, especially elementary, enjoy the snow day. I'm sorry, I got the kid in me. I mean, you still love those days, right? Go sledding and have fun. Just something to think about. I'm just saying, just for this year, if we're still virtual, let them have some enjoyment and some fun. As you know, when you have kids that get a snow day, it creates a kind of excitement. And with the world that we're living in right now, it'd be good to have for them. So just something to think about when we come back on December 14th. So,
like I say, it's an informational item tonight, so you can think about it and we'll come back around it again.
Thank you.
Appreciate it, John. Thank you very much.
Next on the agenda, SEL and mental health supports update.
Okay, so Assistant Superintendent Gutarak, Dr. Getterman, Courtney Curry, and Emily Tregalis are going to walk us through this document here. This is something we talked about when last we met. The SEL and mental health supports available and currently being utilized throughout the district.
Great. Thank you very much, board members, for your interest in this topic. It is essential to everything we do during typical times that we focus on the social and emotional and mental health of our students. But I think, as you point out at previous school board meetings, that it's even more critical right now during this global pandemic. So we're going to start off just grounding our conversation in a very familiar graphic. So many of our People Services staff are very familiar with this graphic, and this is put together by the Collaborative for Academic and Social and Emotional Learning out of Chicago. And what it shows is that at the heart, we're supporting social and emotional development of students is an integrated system of both instruction and support across classrooms, schools, and our community. And what this graphic depicts is that social and emotional learning is primarily focused on proactive skill development among students in the areas of social awareness, relationship skills, self-awareness, self-management, and responsible decision-making. And as it also shows, this is done and achieved through specific social and emotional curriculum and instruction, school-wide practices and policies, and tight and close family partnerships. So while this really speaks to us, I came across this graphic in preparation for tonight, and I love this image because, simply put, this work of social and emotional development and support for students is essentially exercising and preparing students' hearts to be socially and emotionally healthy and preparing their brains to be mentally well. So tonight we'd like to share with you a few things. First, some familiar and new ways we are responding to social and emotional needs of students and families at this time. And then highlight for you 2 significant advancements that our People Services team is proud of related to both social and emotional learning and mental health supports for students. So at this time, it's my pleasure to hand over the presentation to 2 members of our People Services team who will be taking the presentation from here. Emily Tregalis is a school psychologist at the 9th grade center and our People Services program support. And Courtney Curry, school social worker and Empower principal. So Emily, I'm going to toss to you, and it's all yours.
Awesome. Thanks, Bridget. So Courtney and I wanted to share a little bit about what student services staff have been doing to support students and families during this time. So we are continuing to have our student intervention teams meet very frequently, in most cases on a weekly basis since we've been in a remote setting, and just to really talk about how are our students doing, who we know might struggle with learning or their social emotional skills, our students with 504 plans, with IEPs, or even students who we notice may be lacking in engagement during this time. So we're really trying to wrap our arms as best we can around those students by meeting in those teams frequently. We're also continuing to do small group and individual sessions with students. Although it may look different because it's over Google Meet, we continue to provide that service to our students and just offer whatever resources and supports we can as we continue to meet with them. And then we have some unique examples, like some student services staff have created things like a virtual office to provide more access to resources for our students. So I'm just going to click on that to show you an example quick. This is actually my virtual office. So kind of fun. I push this out through the students in our advisory through the 9th grade center. And what's really fun is when I have teachers reach out to me as they're on GoGuardian monitoring their students. They're like, hey, I saw another student on your virtual office accessing resources. All of the objects in my office are linked to a different resource. They can email me from here. So it's really nice when seeing students utilize this as an option. So go back here to the PowerPoint. The other thing we're doing are providing in-service presentations on student engagement and social emotional learning strategies to our staff, just because we know staff are always trying to think of ways that we can keep engaging our students, check on them, make sure they're doing okay, keep them connected to school as best we can. So we've provided, especially at the secondary level, some presentations to help our staff know what resources are available, and then to let them know that they can always reach out to us as well to connect with students. And then I'll have Courtney share some other ways that we're engaging our families.
Hello, thanks for giving us some time tonight to talk to you about some of these ways. So some things we're continuing doing is definitely we're out visiting homes for a variety of reasons. A student may be unengaged or like struggling. Parents are requesting us to come out. So we're going out and we're visiting homes. Our teachers are also just a great support to our students to kind of monitor their first line, like social emotional needs. They're doing that at the secondary level by meeting one-on-one with each of their students for check-ins every other week. And I know personally I've gotten a lot of, not a lot of, but emails from teachers who have reached out and said, like, the student just seems a little more unengaged. Could you check in with them? So things like that. So great. They're doing a great job of connecting and really like understanding this might be a struggle and a hard time for students right now, and to try to keep a temperature check on them and let us know how they're doing. Another fun thing that I get to do at Empower Academy, when the students were back for a short time hybrid, I was out at recess with them, kind of trying to build those relationships. And so when we went back to virtual, I was like, how can we keep this going? So we're doing a virtual recess, or we do Kahoot or Pictionary, and the students just get to come and have that socialization and that fun time. So that's something we're doing here.
Also, we have the Knight's Closet at the high school, which is full of like toiletries, clothing, blankets, just a lot of any of those necessities that families might be in need of right now. I know we have taken supplies out to families or have students come in and pick out what they needed. And something we've been doing the last few years, our district office and other community partners get together and we get to come up with a list of Christmas gifts for some of our families in need, and we get to bring those out and get those wish lists. And so we are still doing that this year. So just some things we are able to keep doing, and some new things and new ways that we're doing to support our students and families. And now Emily's going to show you something pretty exciting that we created this past summer. That's a great resource as well.
So another resource that we created this summer, student services staff got together and we knew this year would be different, and we knew we'd likely have to pivot between multiple different learning platforms, in-person, hybrid, remote. So we wanted to try and create a resource that would bridge a lot of those and engage our students, staff, and our families. So we created this web page with social emotional learning resources. So I'm just going to share a little bit with that. Of this with you, but it's in the PowerPoint so you can look at it more in depth later. This is just the homepage, and like I said, our big buckets are the student resources, parents, and staff resources. And then within each bucket, we have different areas that we wanted to provide resources for everybody. So for students, we have a virtual calming room and also health and safety measures, and I'll go more in depth into the virtual calming room in a little bit. Under parent resources, we have more big buckets. We have the virtual calming room and those safety measures. We also added in how to support your child during the COVID-19 outbreak, just because we figured there are going to be parents out there wondering, how do I explain this to my child? What's accurate, reliable, vetted information? So we put that in here for our parents. And then we also have information on our positive intervention, behavior interventions and supports, as well as our second step social emotional learning resources. So there's a lot of home links under the second step bucket, and also just some remote learning expectations and eventually in-person expectations in terms of our PBIS supports. And then under our staff resources, we have all of those buckets I just talked about, but we added 2 additional ones. We have a school-wide social emotional learning resources page, and then a self-care and adult social emotional learning. So under the school-wide bucket, we have monthly themes throughout the district to try and provide our staff with resources to best engage students and just make sure they're doing okay. So for example, our big bucket in our school-wide theme, I should say, in the beginning of the year was to build a community and how to do community building and engagement with your students, especially because we started in a remote fashion. So we put a bunch of options in here that teachers could access if they wanted to use those to help do some community building activities with their students. And then under the self-care or adult SEL section, we just have some examples of how staff can work on their own SEL and how they can make sure they're mentally and physically well so that they can keep continuing to do this hard work and really just make sure they're doing okay during this pandemic. So just wanted to go into the virtual calming room quick and show you this, and then I'll move on. But we're finding a lot of kids are finding this area really helpful. A lot of times when I'm meeting with students one-on-one, if they're like, gosh, I just was struggling today, or, I'm just kind of feeling blah, we're like, have you tried anything in the virtual calming room? So I'll send them this website, and then maybe we'll do a mindfulness meditation together, or they may be into exercise. So I'll say, why don't you try one of our yogas for stress relief that's in here? So we just have a lot of different options in here that are all evidence-based practices that will hopefully increase their happiness, their well-being, and really they're just good for you to practice. If they're into music, we have sounds and music in here, gratitude activities, helpful apps that they might find useful. So this is a pretty robust resource, and we're updating it constantly. And then we keep updating our schools, like, hey, we updated the website, here's what's new and different. So that's a resource we're really proud of, and
it's always exciting again when I hear that students are on this, utilizing it from teachers who are like, oh, it's Uncle Guardian, they were using this. So that's great to see. And now Courtney is going to talk about some new mental health supports we have this year for our students.
All right, so we do have an advancement in our available support to support our students with mental health needs. If you see the picture there, that is located in the 9th grade center. We now have a partnership with Clinical Psychology Associates, and this is a district-wide partnership. It provides on-site or virtual counseling with mental health therapists for our students throughout the district. We have families in elementary, middle, and high school utilizing it. There's 3 on-site clinics, one at East, one at West, and one located within our 9th grade center. They also have an off-site clinic located in Oak Creek. This partnership breaks down some of those barriers we have with, students can come and access this mental health support right in our schools and in our community. They accept most health insurance, and we have an FAQ regarding these services located on our district website, which I think Emily is going to pull up for us so I can just kind of show you some of that. And I have been getting a lot of feedback from families who are utilizing this service, that they have just had really great experiences. On our website, you'll find information about Clinical Psychology Associates. You'll find some of the therapists working in our schools and their bios, qualifications. So it's just a really exciting resource. There's a phone number on here where you can call to get set up, see if your insurance works with them. So it's just a really great resource that we've heard a lot of positive feedback for, and we're really excited to have that extended partnership and on-site counseling resource available for our students who may be struggling with mental health. We also still have our continued partnership with Aurora for secondary students through the Student and Family Assistance Program. So that is a free of charge program for any student at the secondary level and families to partner with and use as well.
Emily, I'm sorry. Can I ask
go
a
ahead,
question?
Frank.
Is there a way to get this out to every parent? I'm just thinking a couple of people that were in our public input, and one of the parents was, is pretty clear on that, is how do they know about this? So is there a way to, can we email, I know we have that daily folder, right? If you have kids in the school district, is there a way that can an email be sent out to every parent, guardian, saying that this is all available?
Yeah, we definitely can.
Sorry, Bridget.
I think early this fall, when we were just getting up and running, we sent an email, but we definitely can market and promote that a lot more, because certainly we all get a lot of emails. So I think there's many ways that we can do it district-wide, especially also using our social media platforms. And then, Emily, did you want to speak to how we promote it at the school level?
Yes, we did provide it to all of our schools, and it should have went out in school newsletters or from the building level communication, but we also did put it on the district website as well. So the same place where we accessed the on-site counseling services, it's in that same section on the district website as well.
And I would echo, I would echo Frank's sentiments. I know sometimes when you have an email that comes from House 8-3 and you're reading that on East, and you've got a high school update and you've got an elementary school update, that sometimes it gets lost or in a newsletter, and there's lots of articles. If you got an email that said, mental health services available within the district, and it was specifically for that, there are a number of services that I was aware of, and a whole lot here that probably I wasn't even aware of as a parent who has worked with a child who has struggled with some mental health issues. I remember just being beyond overwhelmed, and the thought of having to research or go out there and try to find it, I think it would have stuck in my mind that I had an email that I'd saved somewhere that I could kind of go to. I remember calling Children's Hospital, and every single therapist at Children's was completely booked 8 weeks out, and all you could do is call back daily to see if someone had an opening. So I know even years ago, it was an issue, and I know it's exacerbated with what's going on in the world right now. So knowing that there was this, whether it's the presentation or a letter with links, I think would be really helpful to just put it back in front of people.
I think also, I know you said it's on our website, but if you have to dig a little bit, it makes it more challenging. If maybe for a while it could be put on the front page when that website first comes up, or at least a link to it. I know, especially like that calming room, I know some of our other districts, I think Greendale has a similar one, and they have it right on their front page. I even went to it one day to use it for a while, so these are great, excellent things. And do we have a way to track, not who's using it, because I don't want people to feel that they're being watched, but that it's like how many times it's being utilized, in general, just a way to check to see how many people we're servicing?
Yeah, and definitely because this is a partnership between the school district and clinical psychology associates endorsed by DPI as part of the school mental health framework. Our schools and professionals like Emily and Courtney do have ongoing dialogue with CPA about referrals that they've made, numbers of students they're seeing, and so while they're not sharing confidential information, they are working in collaboration around referrals and use.
Okay.
Yeah. And to your point, Jane, I mean, it would definitely be easier for families to get in much sooner through CPA right here in the district.
But I do believe, Emily, you have the ability, you're able to track students, or you're able to, not individual students, but you're able to track traffic that goes to the webpage. So we have analytics on that.
Okay.
Correct. Yeah, we're tracking the analytics of the web page. We didn't think to start it right away when we created it, so that would have been nice. But I believe starting in the beginning of October, it doesn't tell us who's using it, but it'll tell us like in what city and how often and how many new views and all of that. So we have that data as well that we're looking at.
This is awesome.
I guess just one thing I guess I'd like to add is, there were so many unknowns, but one thing that was clear, the CDC was talking about it, DPI was talking about it, is that, when the pandemic started, there was clear concerns about mental health, and that we were going to need to make sure that our schools were preparing and doing what we could to support the mental health of our students, our teachers, and families. And so, honestly, the hardest part about this presentation was really kind of whittling down from a gigantic list of things that have really been thoughtfully put together. We wanted to showcase just a couple, but I really want you to feel confident as board members that there has been a tremendous amount of effort that has been put in to address a whole host of different needs. And our student services staff are really following up. They're going out to homes. They're seeing kids in groups. Everything that we would typically do, we're providing those services. We're just providing them differently than we may have done in the past.
Is it possible for somebody to show us on the website where we could find that? I know we're sharing the screen right now, but it would be really helpful because sometimes, like somebody said earlier, things get buried in the website, and it's so I can
show it quick.
That would be great.
Okay. So I'm just going to go to the counseling on-site clinic again. So if you go, I'm just going to go like this would be our homepage. So then you would go to the student services section over here on the left. And then we have these three websites up here. We have the on-site clinic that I just talked about, CPA in general, which is who we have our partnership with. And then this would be where you would access the social emotional resources webpage.
Thank you.
Mm-hmm.
And that was allowed. It was actually earlier buried within I don't say buried, but it was commingled with special education. So special ed and student services. So we pulled it out to try to make it its own category.
Right.
Just to make it simpler to find.
Right.
But to Cheryl's suggestion, I think for a while we could shake up the homepage to make it visually right there. Mm-hmm.
Yeah, just because it is a very challenging time for everybody right now, for students, parents, and staff. And so if we can find any little thing that can help in some ways, that would be really helpful. The other thing, as a board member, please kind of keep us in the loop as far as the needs for the Knights Closet and the Silent Nights. I think there's probably a number of us here on the board who would probably love to be able to contribute to something like that, so please keep us in the loop.
I have a quick question. Is there any way that you could share like a student-friendly version of this to either high schoolers or even some middle schoolers? Because I know that all the time students aren't really willing to open up to their parents. So if they had their own way to access all these things, I think that'd be helpful.
Good idea.
That's a great suggestion, Sophia. Thank you.
Okay, any other questions?
Yeah, I've got a question. With all the added use that we'll probably be anticipating coming through this program, is there going to be any added costs to the district? That would be probably for Dan, maybe.
So, actually, the Aurora program is a annual cost per diem, right? We pay, that doesn't change regardless of utilization. And the clinical associates program, Bridget, you're nodding your head, that's at zero cost to us because it's through a partnership agreement. So regardless of level of utilization, those two programs don't incur us any additional cost. So we want to promote those as much as possible for two reasons. One, their innate value as resources, and two, they are a no-cost benefit no additional cost benefit we provide.
Yeah, I was just concerned that with so much more use possibly going into those programs that there'd be a lot of extra costs that would come down to the district. That's the only reason I asked it.
Good question.
But we were able to utilize, so we received funding from a grant that we wrote that was able to provide curriculum and also some additional support. So I think we've got it covered financially.
Thank you, Ted. Thank you, team. We appreciate your presentation tonight.
Thank you very much.
All right, we'll turn it to Andy to talk about the October budget report.
Thank you.
So October budget report, we look to be right on line with where we've been in previous years. Couple areas to just point out. Interest, as you know, interest rates are extremely low. So we probably are not going to meet the mark that we currently have of $250,000 budgeted for that. But Karen and I are working on as many investment opportunities as we can. And as you know, public education money has to be very secretly guarded, or very carefully guarded, I should say. And so we're looking at just some CDs that we can potentially purchase, which will give us, again, very little return in general, but it'll give us more than we're currently getting out through June. But it is pretty low, so we're probably going to miss that mark, and we will reevaluate that for next year. For the expense side, again, we are on track with where we were last year. Just a reminder, transportation, we approved the agreement with Rightway to pay 52% for anything outside of 10 days extended off, 62% inside of 10 days, so 10 or less. And currently, we are paying that 52% rate, although our special education busing is remaining the same as we are busing those students in. So that cost is not adjusted, and those drivers are on. The other one that we're really going to monitor this year is our utilities, so that 330 to 339 line. You can see we're quite a bit lower than we were 2 years ago and last year at this particular time. Some of that is due to being virtual and not having as many bodies in the building, but it is important to note that when we have bodies in the building, we still have to maintain the heat, but we typically don't run our lights and utility, or most of our utilities, well into the evenings as we would in a normal year when people are in our buildings, particularly the high school, until 10, 11 o'clock at night. So there is a little bit of that. But truthfully, the revenue limit exemption from 2017 and then the adjustments that have been put in our new updates for HVAC and LED lights are really putting a great amount of dollars back into our budget. So we'll be reevaluating that particular line item specifically when we talk about the 2021-2022 budget. But I just wanted to point those out to you. But again, all is well in line. And for me personally, when I track our budget, I really take a look at our salaries and benefits because that's about 75 to 80% of our budget. So if we nail that, we know we're doing pretty good. The final piece will just be to take a look at our fund balance. So the next one that you will see in November, that should be our low point of the year. Again, we do receive state aid the first week of December, so that should bolster us up because that's about 25%, 30% of the overall state aid for the year. Currently, we're planning on property taxes in January and February coming in at about 80% of the normal amount. Not that they won't make that by the end of August, but we're anticipating people just paying at a slower rate than they would in previous years. And so we've already incorporated that into our cash flow model, which will allow us to go out and try to invest a little bit of our dollars for a longer period of time, ideally reaping as much interest as we can possibly make. But we've planned for that already. And again, the orange just represents our health insurance fund balance, which is about $1.6 million. So we're very comfortable with where we are this year and having a catastrophic year that we would be able to absorb that. So all is good, I think, going on in this particular year, all things considered.
Hey, Andy, can you refresh Fund 10, item 900? It shows a negative, which is obviously a big from the 300 and some thousand, but what falls into that again? Refresh, because I know it's a big negative.
So miscellaneous, this is related to miscoding on a journal entry, but miscellaneous are items that are typically like paybacks of a previous year expense. So for instance, we just got another one today, our workers' comp. So we get audited every year. It's a requirement of workers' compensation. And we're going to end up paying about $5,000 more for our workers' comp coverage for the 2019-20 year. So we will book that into the 900s because it's a prior year expense being incurred in this current fiscal year. And there's a couple other miscellaneous things that come up. Travel, depending on when it is purchased, falls into the 940s. So sometimes that can cross fiscal years. It gets booked into 940. But there's just a handful of things. Most of them are property tax related. If we're refunding property taxes to the city of Oak Creek for unfunded property taxes to the city, we have to pay that back under a 900. So we usually get some of those every year, and then we recoup them in the next year's revenue limit formula.
Okay, thank you. Any other questions for Andy? All right, we'll go right to action items. Resolution authorizing the issuance of sale of approximately $5,075,000 taxable general obligation refunding bonds, Series 2021A. Andy?
Yep. So we have a series of debts, as you know. We have a couple in Fund 38. Fund 38 is non-referendum debt. So we have one dating back to 2010. Our other non-referendum debt is our revenue limit exemption from 2017. And then we have several Fund 39 debts. Those are referendum debts. As you know, we took out two with our 2018 referendum. We have one with the 2016 referendum, and we have a handful of others that are still going. Periodically, we work with a financial advisor who can review the interest rates on both non-taxable and taxable bonds to determine if it's worth our interest to go out and refinance, just like you would refinance your home. When the interest rates drop enough, it sometimes becomes financially advisable to go out and refinance your home. So we have two issuances. One is a Fund 38 debt, and one is a Fund 39 debt, and those date back to 2010 and 2014 respectively. By refinancing those, the district would save approximately $82,000. So we're proposing to package those two together to achieve that savings. And then those issuances, although it would fall under one new issuance, would still be broken apart in terms of referendum and non-referendum debt. It's about 40-60 split, 40% being Fund 38, 60% being Fund 39. And we would split that at the exact percentages they are, but 40 and 60 for nice, easy references for you. So that would save about 32,800 over the next 7 years in Fund 38. So not a huge savings. We would just reapportion that to Fund 10 general use. But about 49,200 in Fund 39, that is a direct savings to the taxpayer. Those are just non-tax dollars then on the revenue limit. So that would go right back to them. So while not a huge windfall, it's still $82,000, and as stewards of the taxpayers' money, we should do the best we can to either provide it back to them or do something better with the dollars than we're currently doing. And I would ascertain paying a bank or a lender $82,000. We can find something better to do with that dollars than to pay them. So what I'm proposing tonight is simply a resolution that allows for us to go out to bid for these particular bonds. So anytime we're bidding for bonds, we have to go through a series of steps. One is to get board approval to actually do it. 2 is then to go out and bid it, and 3 would be a board approval to accept the bids once that goes out. This is just the formal step to get the ball rolling and allow us to go out and do that.
Do we have a motion?
I have a question.
So Neglia moves, recommends that we approve the resolution authorizing the issuance and sale of approximately 5,075,000 taxable general obligation refunding bonds, Series 2021A.
About 2 seconds.
Discussion. Mark?
Just one question. Because you're putting the referendum debt and non-referendum debt together, how do you separate that out when it comes to the levy?
So that's all done through our financial advisor, but they take essentially the proportion of dollars that are being funded through Fund 38 and the proportion that's being funded through Fund 39. And when we report that to the person who holds our loans, in this particular case are our bonds, we get that split back in the taxable amount. So they would take that $5,075,000, and again, it's probably like 39.89 and 60.11 or something like that.
So it's separated back out when you
Yep, correct. So then when we do the revenue limit, that portion that goes into Fund 38, right, again, gets sent back to Fund 10, and the portion that gets to Fund 39 is just less.
I didn't know if you were allowed to do that if you're putting them both together.
We do, but we separate it out still for the purposes of the revenue.
All right. Okay, thanks.
So Andy, I'm reading this right, the contract, it's good to 2028?
So those will go out to 2028, which is the current year existing on those as well. So we would just be refinancing it again like you do refinance your home.
And secondly, it's not callable.
Correct. It is not.
Because if it's callable, I would probably vote no.
Yep.
Okay, because due to the interest rates. Okay. Any other questions? All in favor, say aye. Aye. Opposed, say nay. Thank you.
We need a roll call vote.
Oh, sorry, Jill. Roll call, Jane.
Yes.
Cheryl.
Yes.
Darren.
Yeah.
Edie.
Yes.
Leah. Mark?
Yes.
Yes.
You're a yes. And I'm a yes. Thank you, Joe. Next on the action item is dashboard update, phase review and discussion.
Can I make a request that due to the probable length of this conversation, we take a quick recess?
So it is 7:27 right now. 10 minutes? 15 minutes? What do we want? 10 minutes. So we'll convene back at 7:37.
Okay, welcome back. Thank you for being patient on that. Action item number 10, dashboard update, phase review and discussion.
So the team has been busy since we last met. We have 3 separate elements to present based on the group's discussion at our last board meeting. First, we'll hear from a couple of guests. Darcy Du Bois with the City of Oak Creek is going to give us a brief update and answer any questions you may have for her. Dr. Stephen Jarob, the district's medical advisor, will also give like what he's seeing in the community, what he's experiencing professionally, and answer any questions you may have for him. Then, when last we spoke, we talked about what would a site-based dashboard for elementary school operationally look like. So Mr. Hamblin will present a draft iteration of that we could put into place at some point in the future per the board's direction. And then after that, we'll hear from Mr. Thielen, who's going to provide a deeper dive into the phased elementary return that we talked about last time, what it could look like, the logistics involved. We'll go a little deeper and see some graphics and have a more informed discussion on that subject based on our last board meeting. So 3 parts, plenty of time to ask and answer questions, and then entertain any motions you may or may not have at the end of this item. So I'm going to ask if Darcy is on the call at this point. Darcy, I see you've phoned in. Are you there?
I am here.
So if you could, please, we're all gathered here. If you have any relevant updates or current state of affairs that you could share with us, and there might be 1 or 2 questions too. Appreciate you joining us tonight.
Sure, thanks for having me. The reality is that I don't have a lot of new information to share. Things have not changed much since we last spoke a couple of weeks ago at the meeting. As of today, we've seen over 2,500 people here in Oak Creek test positive. We're averaging 48 new positive cases per day at this point. We've experienced 33 deaths amongst the residents here in Oak Creek. As you know, the burden rate is 1,859, and our percent positivity is 23.9. Both of those have continued to increase. So we continue to see high numbers of new positive cases, just as I reported a couple of weeks ago. In the past 30 days, we've seen 50% of our total positive cases have tested positive in the past month. So that's just over 1,250 individuals. It took about 7 months for us to get those first 1,250 individuals to test positive. So just exponential growth in the number of new cases. Due to that, we do continue to operate with our crisis standards of contact tracing that I shared last time. So we continue to ask individuals who test positive to notify their own contacts. We also continue to prioritize calling individuals who test positive who are under the age of 19 and over the age of 65 first, as those are the highest risk individuals or individuals connected to highest risk settings. And we are also no longer able to monitor individuals during their isolation period. So previously, they would report symptoms and we would monitor them to determine exactly when they were ready for release from isolation. But we don't have the staffing capacity to do that monitoring any longer. So we are providing education about when they will be eligible for release and asking them to monitor their symptoms themselves and determine when they are eligible. Unfortunately, I do expect to see the sustained high level of cases continue with the holidays coming up and the number of gatherings that we expect connected to the holidays. So I would expect to see this kind of status quo for the next couple of weeks through the end of the year. I'm happy to answer any questions that you might have.
Before we do, we need a motion.
No, not if we're discussing.
It's under action.
But we didn't the last time.
Frank, I had intended to present a whole bunch of things based on your last board meeting request. And if we arrived at a place where you witnessed something tonight in the presentation that reflected a motion someone wanted to raise, I just think you might learn some things during the presentation tonight that might make you want to make a different motion, but of course it's your prerogative to raise one at any time.
No, I know, but you just had it under action, so that's usually.
Board member Verhalen had requested that these updates be noticed as action items each time going forward, and that's why they are. So if we'd like it done a different way, I'm happy to do it a different way.
Darcy, this is Cheryl. I've noticed that the state numbers the last, I think, 4 days have decreased. Is there any reason for any kind of optimism with that? Or is that just a result of what you talked about the last time where there's a delay in receiving the results?
That's a good question. We've seen slightly lower numbers over the last couple of days as well, and I anticipate that it's probably a combination of things. We are certainly seeing labs taking longer to get test results, so I think that is part of it, but we're just not seeing that quick turnaround time after an individual is tested. I do think that we saw lower numbers of individuals choosing to be tested over the past couple of days as well. It's hard to know exactly what the reason for that is. We know it's a busy time of year. We know that, a number of people are wanting to gather and maybe are avoiding being tested because of that. We've heard that from some people. So it's hard to know, and I think it's probably too early to say if it's a trend or not.
Okay, thank you.
Darcy, this is Leah. Could you take a moment and just spell out a little bit about, and I think you've done this before, but just for my own clarification and kind of wrapping my head around it. I think I read in a recent Oak Creek Health Department post that testing was taking about 4 days, where it used to take 4 to 6 days, where it used to take 2 to 3 or something like that. Could you clarify that new extended time frame that testing generally takes as compared to what it was before? And then could you also just tell us a little bit about what that means for boots on the ground? Like, what does that mean when testing takes longer to turn around? What is the effect of that?
Sure, that's a good question. So as we've seen kind of a surge in the number of people choosing to be tested, the labs have been more and more busy as a result of that, and it just takes longer to get the test results. So previously, at a community testing site like our South Shore site in South Milwaukee, we were seeing results come back in about 2 to 3 days after that test was performed. And now, as you mentioned, it's more like 4 or 5 or 6 days. And that's really just simply as a result of how busy the lab is and how many more specimens they are getting to test on any given day. And as far as the impact of that, that means that it takes longer for individuals to get their test results. So not only does it take longer for us to get them as a health department, but an individual who is tested is waiting longer for those results. We hope that most people are receiving the message that they should be staying home after they're tested until they get their results to avoid potentially exposing others. But we know that many people don't start notifying their contacts until they know for sure if they've tested positive. So it is resulting in a delay of notifying individuals who might have been exposed and who should be quarantining. So they are out in the community for longer periods of time, potentially infectious themselves and potentially exposing others. So unfortunately, it's a cycle that makes it hard to slow the spread of disease.
Thank you so much. Darcy, this is Jane. I'm kind of going back probably a long way. When originally you had come to the board and shared 100 as a burden rate in kind of getting kids back in school, and then came again and it had been changed to 350. I know I've heard people say Darcy's recommendation, and I guess I'm hoping you can clarify for me a little bit. I believe I heard you say at some point there are a number of public health officials that get together frequently, and that came not specifically from you, but from a group. And can you shed a little bit of light on, even when that group meets, where is that group taking its direction from?
Sure, that's a good question. So those recommendations were developed jointly amongst all of the health departments here in Milwaukee County. So the health officers in Milwaukee County meet at a minimum 3 times a week to discuss many things related to COVID. And that group jointly developed those recommendations, and they were then shared with, I believe, all of the school districts in Milwaukee County, the same as I shared them with you. And those metrics were really based on a combination of public health sources. So we looked at the Department of Health Services data and recommendations.
as well as the Harvard, I don't have it right in front of me, but I believe it's the Harvard Public Health Institute or something similar that puts out that information. So those metrics were based on information and data provided by those entities.
Thank you.
That document, in case anyone is interested, is linked on this situation report under the Regional Health Officer supplied guidelines from prior meetings. So if you're watching this at home or something like that, you can link to it. It's a color-coded document that the board has discussed a number of times.
Hey, Darcy, Frank, good question. The other facilities, companies in Oak Creek, a couple other school district or schools, are you having the same conversations as you are with us? And because I noticed a lot of them are, most of them or all of them are still open. Just curious on how those conversations, since you have the statutory limits, I was just curious.
Yeah, we have shared the same metrics and the same data with all of the public and private schools here in Oak Creek.
Interesting.
Darcy, Darren Grabowski. What is your take on, we hear one scientific analogy, hunker down, stay home, social distance, wear a mask. Then we hear another one where it says the kids should be in school. I see a lot of kids out there with their parents and families, Walmart, Pick and Save, Myers, whatever. They're out there. They got the mask on, obviously, but they're still out there touching things and whatnot. And how can I put this? Our rate is high in Oak Creek, and we have had no school, truly. Okay, so if we go back to school, is that rate going to go higher, do you believe? Or is it still going to come on a constant downward spiral?
I think that's a question that's hard to answer. We still don't have a lot of data about the impact of schools on disease spread. I think that one especially important question is how often children are exposing each other, and we know that children are more likely to be asymptomatic, and so they maybe have COVID and don't know it and are taking that home to their families and maybe contributing to the increase in cases amongst adults that we're seeing. So I think that it's hard to know exactly what impact it would have on the number of cases here in Oak Creek.
How many residents of Oak Creek have been tested since, we'll say, March until today, current? Do you know that number? How many physical residents have been tested? Not positive or negative, just how many have been tested in the city of Oak Creek?
Sure. I believe today's number was close to 12,000 individuals in Oak Creek have been tested at least once.
Okay, so 12,000 out of a population of 37,000?
Mm-hmm.
And there's how many positive right now, you said? 1,200?
2,500.
Okay.
All right, if there's no more questions for Darcy, I appreciate you joining us this evening. Thank you very much. We've also asked Dr. Jereb to join us this evening. Dr. Jereb, are you on the call?
I am.
Thank you very much to you for joining us as well, making time in your evening. I was wondering along similar lines, if you could share with the board and any listeners we may have just the current state of affairs, what you're observing in your practice, what your experience has been like as of late.
Sure. So I think to echo what Darcy had mentioned, we're definitely seeing a lot more COVID cases in our clinic over the past month. Over the past 2 weeks, our positive rate is a little bit higher than the city average. We're at 25.5% of the kids that we've tested over the past 2 weeks have come back with a positive result. I guess the good news is that for most of the kids we're seeing, they're not requiring hospitalization, so they're not getting as sick as the adults. So there are those exceptions to where kids get really sick. We're just not seeing that many of those, which is good. The other thing we're seeing is we're not seeing a lot of the other illnesses that we normally see this time of year. So we're not seeing the strep throats, the croup and other upper respiratory infections, ear infections. It's mostly the kids who are coming in are having symptoms consistent with COVID, and a large percentage of them are positive. So we're seeing a lot of it. Again, the good news is that those kids are not getting as sick when we compare them to the adults. The biggest concern is their ability to transmit that to others around them.
Thank you, Dr. Jareb. I'm wondering if the board has any questions for Steve while he's here.
Dr. Jareb, this is Cheryl. I was just wondering, do you test every child that comes in with symptoms, or is it more like age-based, or do you make some assumptions based on symptoms, knowing that that test can be pretty invasive and pretty traumatic for young ones?
So our current policy is that if someone is in the clinic who is symptomatic, we will offer the test. So not everyone takes us up on that offer. The flip side is we're not necessarily bringing in everyone who has symptoms. So if someone comes into the clinic, or if they are sick enough that we recommend that they come into the clinic, we're testing them. But there's a large percentage of our patients who have symptoms that are consistent with COVID, who do not come into our clinic to be tested. So either they are referred to a community testing site, or they are quarantining at home without being tested.
So those statistics that you gave us, are those the percentages of tests done in your office, or is it tests of your patients, so that if your patient was tested at an outside facility, would that still come under your numbers?
So these numbers are just the kids we've tested in our clinic itself.
Okay. Thank you.
Doctor, this is Frank. I don't know if you saw today, WISN said, Dr. Anthony Fauci said that keeping students in school in this coronavirus pandemic is very beneficial for learning and families. And he said, we need to try to keep kids in school. I don't know if you read that article, and just curious your thought on that.
So I have not read that article. I think all of us, our belief is that kids should be in school, and that's where we want them to be. I think the part where everyone has their own opinion is when is it safe to do that? So we want everyone to be in school if we can do that safely. So I think everyone has a different opinion on where that decision comes down. So I think to some of the comments that were made during the community time earlier in the meeting, we're definitely dealing with a lot of mental health issues. We see a lot more kids who are coming into the clinic with anxiety and depression, whether it's due from social isolation from not being in school, the stress of the pandemic and worrying about health. So we definitely are seeing that in kids. We're balancing that with the risk to their health and to them around them if they're in school and getting more exposures.
Thank you.
I've got a question. This is Mark for Halen. I was wondering if you'd more or less agree with the statement that was given by one of our parents a while ago during the comment period, and I've heard this from others as well, but a general statement that the virus, now that it's out worldwide, will be ever present and will never probably be totally eliminated. It's always going to be around because it's here and it's here to stay. Would you agree generally that's a true statement? And I'm comparing that when you compare it to any other illness that would be out there, measles, mumps, that's technically those things have been cured with vaccines and whatnot, but they're still present at certain times, and cases do reappear. So would you kind of put the COVID-19 in the same mantra as the rest of them, that it's here to stay and you're never going to totally eliminate it?
So I think that's a hard question. I mean, there have been illnesses that we feel we've eradicated with the use of vaccines, but to have it truly gone completely, I think if that's going to happen, it's a long ways away before we ever get to that point. The idea is that if you can get through vaccines and other measures to a certain amount of herd immunity, then the risk of it spreading through a community and having pandemic levels is much lower. So it's balancing, again, trying to get to a level where most people are protected from the virus, and then the numbers will go down. Do I think it'll be completely eliminated? Probably not.
Okay, thanks.
Dr. Jerb, do you have any like anecdotal evidence at all of like how often like maybe kids are getting the virus and then it's being spread to their members of their family, or are they getting it from family members first, or just curious about that?
Yeah, that I don't know the numbers on that. Yeah, I don't know. We see it both ways. Yeah, I mean, we see it both ways, that a parent has symptoms first and then the kids come in and vice versa.
Okay.
But I don't know the percentages.
No, that's fine. That's fair. Thank you.
Dr. Darren Grabowski. They're saying, Dr. Fauci, I should say, he's saying that a vaccine will come out. I'm hearing now, they went to the FDA to get it approved, blah, blah, blah. So a vaccine won't come out for the American public until, we'll say, April or May. Okay? But there's no guarantee everyone in the United States is going to take that vaccine. So say the schools are reopened, and there's people that took the vaccine and the people that didn't take the vaccine. So you're safe one way, but you're not safe the other way because you don't believe in the vaccine. Hypothetically, I'm just saying. So what's the reassurance for the people that do take the vaccine to the people that don't take the vaccine? Does that make kind of sense to you? Because no one has to take this vaccine if it does come out in April or May to the American public.
True. I guess I'm not sure your question. So the only way for the vaccine to work is that if enough people get it and have a proper immune response to it. So if the vaccine comes out and not enough people get it, then we'll continue in the cycle of people continuing to get COVID, and we'll never get out of the cycle.
Okay, that's what I asked, yep.
All right, Dr. Jerab, thank you very much for joining us this evening. We appreciate you making time for us, so thank you. Much appreciated.
Thank you.
My pleasure.
Okay, folks. So after a brief update from Dr. Jerab and Darcy Du Bois, our discussion last time we talked came down to the brass tacks and operational feasibility of site-based dashboards if you were to put them into place at some point in the future. We talked about the monitoring dashboard that's present on the website currently that we continue to update, but we also talked about how behind that dashboard are a series of management and human resources decisions and data tracking that needs to occur that we'd have to follow, and it comes down to some key staffing pieces that would allow us to use this at some point in the future when the board saw fit to put them in place. So the team put their heads together, and Troy's going to present to you a preliminary version of what we think that would look like. He's gone to some length here, and he's going to scroll through some slides and take any questions you may have regarding this draft. Troy, take it away.
Thank you, Dan. Thank you, members of the board. I'll try to be quick but thorough. When it comes to staffing our elementary schools, and for the sake of our discussion, I guess the questions that we need to share and provide with you is, how do we do it? What do we do when people are gone? What are some of the options that we utilize? And bottom line, how do we keep our buildings running when people are gone? So to start with the how, when you think of all of our elementary schools, you're going to think of a very, very similar / almost identical staffing pattern. From a professional staff standpoint, they all have one principal, one counselor, one learning coach, one psychologist. From a support staff standpoint, they all have a library clerk and 2 office assistants. From the teacher and aide standpoint, in general, that's based on how many kids we have, a few other things that we throw into it, but in general, it's how many students. I mentioned student teachers and long-term subs, which I'll talk about a little bit later. Normally, that's not something we would consider when we're talking about staffing. So this year,
in anticipation of this that we're all sitting in, debating, talking about, what did we do? We asked all of our aides, would you be interested in obtaining a substitute teaching license? We offered to pay them their hourly rate for training. We offered to pay for the training, and we offered to pay for the substitute license. We have such a great group of aides. 17 of them said yes, they took the training, and now we have 17 new substitute teaching licenses for a total of 29 staff, support staff with a substitute or a regular teaching license in our elementary schools. So kudos to that group of employees. But what do we do when our staff is gone? I've been here, this is my 9th year. I think the year before I came here, the district switched to teachers on call, possibly 2. So they have been our backstop for absences. This past school year, the teachers on call filled our absences at a rate of 90%. That's the BC before COVID. After COVID, and with a very, very limited sample pool of data, they were filling our elementary schools at 65% this year. So not quite 2 of 3 being filled. And then the real question becomes, how do we get over that 65%? What do we do? This year we piloted having some of our teachers who were quarantined for one reason or the other, teaching at home. We put someone in the classroom it could have been a guidance counselor, it could have been an aide, it could have been a teachers on call substitute teacher, it could have been a teachers on call aide substitute. So the teacher teaches, someone's there helping the kiddos with the work, someone's helping with the classroom management, someone's helping them get to lunch, to recess, etc. Another idea, which may or may not work, we've seen very low degrees of success, just trying to pay more to get people, and that's the increase the sub rates. Everybody's experiencing what we're experiencing. You're getting quarantined, you're at home, your kids are at home, the schools are closed, wherever the kids go to school. So right now it's just a lack of people being able to teach or to substitute, teach or be an aide. So then what? We're filling at 65%. We've exhausted some of our options. What do we do internally? And mainly not me, but our principals, they'll take a look at, all right, who can we use to fill in for Troy if he's gone, not able to teach today? We can look at our support staff. We can look at the professional staff we talked about. They could also say, we're going to cancel a special today, and we're going to have one of those teachers teach the class. Again, none of these things are optimal. Whatever you do, you're taking away from something, from someone who needs the learning coach, school counselor, the art, music, PE, etc. If you remember, I put in student teaching and long-term subs into our staffing. This year, DPI has allowed districts to utilize student teachers in a substitute capacity. So I had asked all of our principals before the start of this year to please accept every student teacher we could possibly take. Unfortunately, this is for second semester. We only have 2 elementary grade level teachers in our district. We had quite a few this semester, but only 2 for next semester. This year, I also have a rather odd situation. Since my second year, we started hiring permanent long-term substitute teachers, many of whom became regular teachers with us. Some really great teachers, actually. Generally, the FMLAs go like this. There's a wave in the fall, there is a winter wave, and then there's a smaller spring wave. And the idea being, we hire these long-term subs, they do 12 weeks in the fall, they do 12 weeks in the winter, and then they do something in the spring for the last few weeks of school, and in between they help out wherever we need them. So it's worked out really, really well.
This year, again, very odd because we only know about family medical leaves when we're told about them. So in the fall, we generally have little to no idea about winter. In the winter, we have little to no idea about spring until we're told by the staff who needs the FMLA. So this year, we have a very we have a small pool of winter FMLAs, and they're mainly in the specialty areas like school psychologist, special ed. There are, right now, to the best of my knowledge, very few grade level elementary long-term substitute needs. So the good and the bad of it was, had I known this, would I have done something different? This year, probably no, because we need everybody we can get. So we're fortunate. We're probably going to have, after the winter break and beginning into second semester, we're going to have probably 4 free long-term subs. There's a current student teacher who we really like right now that we're contemplating talking to about staying on with us, helping us out for the rest of the year once we're live. And this year we have 2 other long-term subs who've been with us. They know our technology. One is a long-term person that we've worked with in and out various capacities, and we're thinking about offering those 2. Would you be willing to stay on once we're open? So the goal being, we would then have 1 per elementary building that's free. Now, if somebody needs a family medical leave come spring, we're going to have to reassign, but it gives us 1 more person in the building once we get up and running. Lastly, every building principal does this. They take a class. Can't tell you how many times each of them do it because, we just don't know. Behind the scenes, Sonia and I are also helping, trying to move people from building 1 to building 2. Sometimes a teacher will put in for an absent but come in anyway and forget to cancel the sub, so we'll move people around. We're calling teachers on call. We're calling people that we know that have worked with us in the past that may not be working now. So that's something Sonia does every morning. We're just looking at who's staffed, who's not staffed, where are the openings. Let's see what we can do to help. So bottom line, what does it mean for us if we use the student teachers, or probably more appropriately, the student teacher would stay in the classroom they're currently in, and our teacher in charge, I guess, for lack of a better term, would be put somewhere else in the building. Once we look at our long-term subs and utilize them, once teachers on call fills positions that we need, what we get to, and the bottom line to keep our elementaries running is we can run with 5 unfilled teaching positions, but it's really a 1 to 2 day max thing. It's just too many people being pulled from too many different areas to really run a school effectively. And while I didn't ask the principals this, even if it were 4, we're talking a 2 to 4, maybe 5 day maximum, because you just can't keep running like that. So when you think of it, what would that have looked like? And I picked 11/19 as a day to say, okay, of all of our staff who are in quarantine, here's the numbers. And then if you see in the orange, the long-term substitute column, that's 1 person. If you assume TOC fills at just under 2 out of every 3, you would see what would have happened on 11/19. So on that particular day, Carrollton would have had 1 of those people in their building that I identified filling in a classroom. It could have been a learning coach, could have been an aide, could have been anyone, could have been Paul, the principal, who knows. So again, 11/19 was just the day I happened to be working on this. The numbers change. Bridget could tell you way better than me, but the numbers change on a day-to-day basis. Some people go off the list, some people come on. But that's what it would look like. So with that, hopefully it was pretty concise, and I would be happy to answer any questions you might have.
Can you go back a slide?
Oh God, I just
sorry.
Sure. go ahead and ask the question,
No,
Jen.
I was just wondering if you could just define those numbers. So those numbers were people that were either out of school due to quarantine or positive? Is that?
They were quarantined for one reason or another, yes.
Okay, thank you.
So this is like if you take that monitoring dashboard that's on the website and you just like pull it to the side and say, what's behind it? What's behind the curtain? Right. So this is Troy looking deep behind the curtain for us at what does all that mean operationally? So like, if you subscribe to the Wisconsin Education News or you're an avid consumer of school related news on television, you'll see XYZ school closed for 2 weeks or whatever it is. What they're showing you in most cases, I'm comfortable asserting that in most cases, it's a human resources analysis similar to the one Troy just ran for all of you. So, for example, if you're a smaller district, K-8 district, or just for whatever reasons, you don't have the same sort of county medical official or whatever, or haven't adopted the same metrics as we or others have, this is probably the analysis most places would use to make a rolling closure decision. So Troy, Bridget collected all this together and wanted to give you a deep look behind the scenes so you would see the work being done in the office or related to a subsequent closure decision if we're making those down the road.
Troy, I don't know if this is a question for you or for Bridget. Of the teachers that we have in the district right now who are quarantined, either because they were exposed or because they were a positive, what percentage of those teachers are still able to teach right now virtually?
I would say it's a very, very high percentage. We've only had a few who have been unable to teach, and that's usually been for a day or two. And that's teaching at home, doing their normal classes. It's way under 5. I would say 2, maybe 3.
Okay.
Bridget?
Correct. I would agree with Troy. Most have been able to continue teaching. A few staff who've been positive have had a few days of significant symptoms and chose to use a sick day, but that is short in duration, as Troy mentioned.
And
Bridget, I know Troy used the 19th, I think, as his date that he pulled these numbers from. Are those numbers pretty much the same as what today? Or are they worse or better or just?
It's going to be different, Cheryl. It's so random. I don't know if random's the right word, but that's probably the best word I can come up with.
Right, there's just a ton of moving. There's a ton of moving parts. You know, we've got 1,000 employees, and people are constantly coming on and going off of the quarantine list. It's a pretty significant portion of Bridget and Troy's job, and then admin too. Like I think the last time we talked, Bridget gave us a closer view of what contact tracing and like how quarantines actually function kind of looks. So it's constant, you know, and we're assuming that it will be for the duration of the foreseeable future. So
yeah, it's definitely fluid. It moves 7 days a week. People are emailing, and our staff are really communicative. We ask them if they learn that they're a close contact, if they themselves are positive, or if they're experiencing COVID-19 like symptoms, that they send one email to include their direct supervisor, Troy, his specialist Sonia, and myself, so that together the 4 of us can coordinate if there's leave, that Troy needs to support the staff member with, the principal for coverage, myself for data tracking, and so it's fluid throughout the week.
Okay, thank you.
Troy, question for you. If parents want to volunteer and help out, is that doable?
Well, when we did all of this way back in the spring and summer, I believe we passed a policy that said we weren't going to allow volunteers into the building. So that would have to be changed. This is going to sound odd, me saying it with all the stuff you've heard so far. If we're able to open, and once we get open, I'm confident that if we do it on a building by building case where, we just can't run Carrollton today. I mean, if you think about it, we could move some of their staff to help out There's just other options.
Right.
But there's no way we could run at 4 or 5 unfilled positions for the duration of a quarantine of 10 business days in essence.
There's just a lot of moving parts to consider here, and shifts, and the board would have to be comfortable with a lot of discretionary decisions like what Troy has described, and we'd also have to be clear-eyed about the fact that isn't a lot of notice associated with decisions like this. So, like if we had to close a classroom or a school, right, you might be operating under just a few hours of notice for a decision like that. Like those will be, like that can be jarring, as you've seen when we've had to close our campsites or other programs throughout the district. It's here, we've reached a critical point. Now we have to communicate that this isn't going to be operational for a duration of time. So,
is there any part of this presentation that will address the teaching and learning aspect of all those changes?
Probably the next 2 hours of our life.
That's what I thought. I just wanted to make sure that was going to dovetail.
Mm-hmm. Yep, we just tried to dissect it into pieces. Guest speakers, the logistics of human resources, then teaching and learning will take us to the finish line.
If no other questions, I will happily turn it over to that group.
Hang on, Troy, I gotta ask this question real quick. Just gonna throw it out there. Hypothetically, say we move forward opening the schools, and what happens if the teachers get together and half the staff obviously is gonna call, I'm not gonna say going to, but it's hypothetical, half the staff would call in sick, or say I've been in contact with someone with COVID, would they be quarantined for 14 days? And then you have to shut down the whole district again for 14 days if they all got together and said something like that. Is that not true?
If you mean the entirety of the elementary school staff getting together and saying, in essence, I'm sick, if that's what you're saying.
Or in contact with someone with COVID, they'd have to quarantine.
Let's address them kind of separately.
Okay.
The first part, the staff getting together and saying I'm sick, we have such a good staff who are dying to be with kids. I don't think that would happen. The second part, if they are quarantined, there's not a lot we can do about that. So we haven't, I don't know, Bridget, you probably know this better than I do. We haven't seen numbers like 5 staff from a building quarantined at one particular time due to one particular incident. That would be a high number for us at one time for one incident. And I think what we're obviously the staff, it's not coming from the kids right now because they're not with them. So it's coming from other aspects of their lives.
Thanks, Troy.
Mm-hmm.
Okay, if hearing no more questions for Troy, we appreciate the work you did on this, pulling this together and helping us understand how this functionally works. I'll note that Troy coordinated with some principals, worked closely with Bridget, just wanted to give us a real view for how this would play at some point down the road. So thank you, Troy, much appreciated. All right, the next portion of this update here, hearing the discussion at our meeting when last we were all together, a lot of specific questions about different scenarios and learning modalities for elementary students. So Mr. Thielen pulled together a diverse group of different individuals and laid this all out in greater depth and detail so we could have a deeper understanding of some of the discussion that was had last time we were together. He's going to take us through these next couple of concepts. So take it away, Dan, whenever you're ready.
You can see it.
I can't.
Go to your computer.
All right, thank you. Looking forward over the next 5 hours to have a conversation with you about this very important work that's taking place. In all seriousness, John Krennick is also on the line with us as well, and he may be interjecting some of his thoughts with regards to the work that we've been doing. So, as Dan said, as a continuation over the last couple of weeks, especially the last time we met, tonight I'm going to present an overview of what you're going to see. We will present to you some additions and enhancements to what we've done to phase one, as well as just, again, defining what a phase two reentry would look like based off of our phased reopening plan. We will also talk about a phase two reentry discussion prior to the burden rate below 350 and discuss what opportunities and challenges that come with that. We will also be exploring possible options to return to a modified phase two for families who desire a remote learning experience. So as we talked at the November 9th board meeting, there was some talk about a high flex approach. We will talk about not only that, but also some work that we've been doing over the last couple of weeks that's been called extended remote. And then we will finish our presentation with possible options for consideration. And again, any questions you may have with regards to that. So as I move on, why isn't this? How come my slide won't go forward?
Go to the actual presentation.
What am I looking at, right here? Oh. Okay. Here we go. All right. Apologize for that, just a little glitch here. So I wanted to share with you, since the last time this board has met, the work that's been taking place by multiple stakeholder groups over these last 2 weeks. We've worked very diligently with these multi-stakeholder groups to gather input and feedback for this presentation and potential options for consideration. We've had 10 formal meetings, countless informal meetings. And as you can see, the different groups that have met, the cabinet has met twice during that period of time. We've met with the elementary teacher committee twice during that period of time. Our curriculum instruction team has met twice during that time, and we've also had some of our elementary principals join us as part of that discussion. Bridget and I, with our two areas, we meet bi-weekly, so we have a collaborative joint meeting with student services and student learning. So we had an opportunity with those two groups to come together and meet, and we also had some elementary principals with us, as well as senior leaders. And then we, last week, we had an opportunity for some of our elementary principals again to come around and have discussions about this. So there's been an awful lot of time and energy and meaningful discussions and research gone into the work that we were doing, and we are going to be presenting to you tonight. So I want to talk about the phase one additions and enhancements. So as we continue to focus on our continuous improvement model in this district, we're always reviewing the work that we're doing. It always comes circular and reviewing that work to see where we can make some enhancements, make things more robust and so on. So we wanted to take a look at some of the feedback that we were receiving from staff, from families, and so on about increasing synchronous time for social studies and science. Currently, students were receiving 15 minutes each day asynchronously. So as we worked with all those groups that you saw on the previous slide, we had worked on a plan to come up with an opportunity for students at the elementary level to receive more synchronous time in science and social studies. So what we've done is we've worked to replace that asynchronous time with synchronous time for science and social studies. We've also worked, and you heard a wonderful presentation that was done by Bridget and Emily and Ted and Courtney about SEL earlier. We were also able to work in 1 day of explicit SEL instruction time that goes along with this continuous improvement piece of what we're doing during phase one. There's also been some discussions about looking at further exploration with our specials and providing some synchronous time there. We're not there yet. We have made some good progress in some of those conversations. Prior to us going into back to phase one, we were probably about a week or so away of making some modifications in phase two to at least have students taking art in the art classroom. So we're still exploring that option, about the possibility of looking at that as well as potential down the road for music and Phi Ed. Just a reminder about the full Phase 2 reentry. So based on our phased reopening document, our Phase 2 reentry would be what it was prior to us going into or going back to Phase 1. So all of our elementary students would be in person 5 days a week. They would be in their cohort models, receiving instruction within their classroom. The mitigation procedures would be in place, face mask, hand washing, social distancing as much as possible. And then students would be, again, specialists, we would still examine the idea about an opportunity to be able to try to provide some opportunities for instruction within those respective classrooms. But starting out, if we were to go back into Phase 2, we would go back into a complete cohort model and examine further opportunities for art and music and Phi-Ed to potentially be in those respective classrooms. So looking at a potential Phase 2 in-person learning with the burden rate, prior to the burden rate below 350, so above the 350 threshold, what are some potential opportunities and some potential challenges? As we've heard very passionately from our community, as well as speakers at each one of these meetings, there are some families that have a strong desire for face-to-face option. I think we would all agree in this room that we would love to have our kids in school as much as possible, but there are some potential challenges with that as well. And you had heard Troy just speak about some of the staffing concerns about keeping buildings open. Also, we continue to hear from countless numbers of staff members, teachers, administrators, and so on about concerns with regards to safety if the returning with the burden rate as high as it currently is. We would be also concerned about rolling closures and continued uncertainty in transitions from face-to-face to remote. I know when I speak to a number of teachers, there's always that 2-week cycle that they go through in terms of, are we going to open back up? Are we not going to open back up, and so on? So there's just some of that stress that's placed on the system as well. If we were to return to in-person learning prior to the burden rate being below 350, there would be a need for 3 educational options. If we're not following the adopted metrics that were approved. And that third option would be some sort of support for families that want to continue with the remote option. So we would have in-person, we would have some sort of remote option, and then we would have our OC virtual option. So we would have these 3 educational options that we would potentially have to navigate with. And then there would also be the concerns and the challenges about providing support services in multiple models. So again, going back to the supports for special ed, which have been brought to the board floor before, ELL, we've heard, continual talk about the SEL piece and so on. Now, as we move into the next part of this discussion, we're going to take a look at not only revisit the HyFlex model that was discussed on November 9th, but there's also another model that we want to share with you based on the hard work by the multi-stakeholder group called Extended Remote Options. And we will move forward with that right now. So I'd like to define both. So HyFlex defined is really a combination of face-to-face with online learning at the same time. So you'd have a teacher within the classroom that would be doing both at the same time. The teacher would have to obviously plan for the online course as well as needing to manage that face-to-face instructional piece. And what we've been finding in our research is that it works well for courses where students arrive with varying levels of prior knowledge or expertise in the subject matter. The HyFlex model was originally developed for the colleges and universities to function at. We do know in our research that school districts have been using it or have been trying to use it and so on, and we will talk more about that in the next couple of slides. The extended remote defined, it would be a situation where students would remain in remote learning until the burden rate falls below the 350. When that burden rate falls below 350, students would return to face-to-face. So in essence, Phase 2 is how we have it with our phased reopening plan, but they would continue with their extended remote teacher. And we'll get into all the the organizational components of that coming up as we discuss extended remote in a much deeper way. The schedule lessons and grouping based on successes from first semester, and we would work to try to have students remain in their home school to the greatest extent possible. So these are the two areas that we are going to focus on over the next few slides. So as we move into the HyFlex model, we have used the HyFlex model as a way for a short-term solution when we've had students in quarantine. So we would have that iPad component where we'd be doing the live streaming, and teachers would use that in the classroom as a way to help those students who are in quarantine. Some of the other potential opportunities there, students, in that model when they're home in quarantine, they have that connection, they see their students, they're excited to see their students, so there's some positivity and some connectedness with their classmates when they're in this model under quarantine. Some of the potential challenges, and this was kind of a summation of the rounding work that the principals have done, the elementary principals have done with their staff. So they went around and, in essence, did some survey of their staff, had some conversations with their staff about the iPad live streaming HyFlex model that we've spoken about before. There's been some feedback, so it's like watching closed circuit TV with limited interaction. The struggle that teachers have in terms of trying to give meaningful attention to both platforms of teaching face-to-face as well as remote. And then looking at all the critical components that you have when you're teaching a class of engagement, instruction, and assessment, and trying to do those meaningfully with all three of those in both settings. So those are some of the major challenges that have been reported to us that we have worked with in terms of our conversations with our principals and the roundings that they have done. As we take a look at some of the research, as I mentioned before, on the HyFlex model, as I mentioned, it was originally designed and developed for the university and college level. So there's been some research out there in terms of this particular Dr. Deb Kelt, who's a professor of practice at the University of Texas at Austin's College of Education, is teaching online and in person simultaneously work. She went on to say when districts ask teachers to do online and in-person classes at once, they layer those two sets of challenges on top of each other. That means teachers at every level experience struggle to teach either group well. A couple hours north of here, northwest of here, Stevens Point, most recently, the superintendent, in a response to his families and his community, has shared that it's become clear that offering the in-person and flexible e-learning option in tandem is not sustainable. So it's something that they had done for a period of a few weeks and had gone away from that model because it was just too much of a challenge to overcome as they work to try to implement that. And then some other continued research in this area with a HyFlex model. Teaching in-person and virtual students at once. It's an instructional nightmare, some educators say. This particular research shows that teachers across the U.S. who are juggling in-person and virtual students simultaneously say the quality of instruction is lower than it would normally be as they try to keep themselves positioned in front of cameras, keep the in-person students from feeling frustrated, and keep moving through their actual lessons. The results is they are struggling to reach the students who need their attention most. And again, that's a lot of the same type of feedback we've heard from our own teaching staff. And then educators teaching online and in person at the same time feel burned out. While most K-12 schools have chosen to go either online or in person at one time, the double duty model is among the most labor intensive, according to education experts. Getting into the other option, the extended remote. The extended remote, the potential opportunities for there is that other than OC Virtual, it is an option for families for the burden rate above 350. It capitalizes on the continued successes of remote learning that students had throughout the first semester. It's an alternative to the HyFlex model, which has been shown not to be effective at the elementary level. And the opportunities, if this choice was selected, we would have some time to make some adjustments. The potential challenges with extended remote, it's like starting a new school year while running a current school year. There would have to be a lot of re-rostering, and I'll get into that in just a moment. But in essence, you're taking what is done normally over the course of about 3 months and trying to compact that and do it over a period of a few weeks to make this a reality. There's likely a result in the possibility of some changes for a teacher for second semester in order to accommodate the extended remote option. And as mentioned before, with regards to staffing for both extended remote and face-to-face option, potential for tough decisions. So if you're looking at students whose families want them to remain in remote, and if we're looking at a school, for example, that may be a 3-section school, might now have to become a 2-section school, and now you have to work with your staff to see who would like to teach that section of remote versus remaining in person. So again, you'd have some of those staffing challenges that you'd have to hammer out. Students may have a different teacher from a different school based on numbers. So for example, if you have, say, 10 kids in first grade at Meadowview and 5 kids in first grade at Deerfield, that's a total of 15. We may have to combine those based on staffing numbers, based on the staffing scenario. So it may be a situation where students may have a different teacher from a different school. Obviously, the relationships with current teachers. We're nearing the halfway point or so of the school year. There's been a lot of relationship building that teachers have done through the challenges and through the unique learning environments that we've experienced so far this semester. Whether it's the few weeks that we were in person or what they've been doing through the online piece. You heard earlier about the SEL component, those types of things. As we have had an opportunity to meet with a lot of the teachers through the elementary committee that's been taking a look at some of this work and listening to all the variations of work that they've been doing with their students over and above some of the things that we've already put in place. And then the possibility of split grade levels across buildings depending on numbers. So again, taking a look at that staffing number, if we needed to make some changes with an extended remote and the possibility of some staffing decisions that we would need to make because of those numbers. So the modified phase 2, extended remote changes that would need to be made. Every elementary school would have to create a new class rosters based on face-to-face and extended remote learning. So as we talked about before, we would have to take a look at re-rostering. So in essence, we would have to survey families if the decision was made to go back for them to have an option for extended remote. We would have to survey families to determine what their choice would be, whether it's to come back face-to-face or to stay in extended remote. And then that information then, as that comes in, would give us information in terms of how we would work at re-rostering our elementary schools. Again, as I mentioned before, students will have different teachers based on some teachers having to teach extended remote. So the teacher they may have now may not be the teacher they end up with based on having to go to the extended remote. Some students might have teachers from different elementary schools, as I mentioned before. When the burden rate falls below 350, all extended remote learning students return to their home school and will stay with the extended remote teacher. So once, if this is an option that we choose and we go through and re-roster our students, once we re-roster our students, and if we come back at a certain point where we fall below that 350 mark and we come back at that certain point, all those students would stay with that teacher that was assigned to them extended remote. We wouldn't re-roster again and go back to the way it was prior to us going into that model. And then buildings would need to make a challenging staffing decisions of who will teach extended remote and who will teach face-to-face. So again, that staffing component. So if you have a 3-section school, you got 3 first grade teachers that would need to get together, have some sort of discussion, maybe with support from the principal, support from HR to say, all right, here's the situation, here's the data that we have, how many of those students would end up going into extended remote, then that would determine how many teachers then we would need to place in extended remote based off of that data. So with that being said, there's some possible options for consideration. Option 1 would stay with the binding criteria as the school board has previously adopted. Elementary students would return to school when the burden rate falls below 350. Option 2, the school board elects to return elementary students to the school with the burden rate above 350. The school board would need to determine that date. Option 2 requires a significant restructure of 4K through 5 to ensure alternative options are available for families. Number 1, under option 2, families have the opportunity to attend face-to-face learning with the burden rate above 350 as determined by the school board. And number 2, extended remote learning allows families who are not comfortable with the burden rate above 350 that remote learning option other than OC virtual. And when that burden rate falls below 350, students can return to hopefully their home school with that extended remote learning teacher. Questions?
So as you can see, this is a very robust, detailed, and logistically challenging scenario that curriculum instruction has put before you today to talk about and look at. There's a lot of moving parts here. There's cascading communications, dates, all kinds of stuff. But we did our very best to, in all 3 phases of this update tonight, reflect the wide-ranging discussion that the board had when they were last together. We were all over the place. I'd heard various people describe it as a pinball kind of evening, right? So we've done our very best to put all of those different discussions together on paper in like a thoughtfully constructed series of scenarios for you to ask questions about.
I have a question. Could we talk a little bit more about the special education, the effect that moving into this option 2 might possibly have on current special education services?
Sure, I can answer that. I think it just, some teachers would have caseloads where they have some students in OC virtual, some potentially in person, and some potentially staying home, choosing an extended remote option. So it becomes just a logistical challenge for staff to manage several different schedules of when some kids are remote, when is their instruction live, and trying to just juggle several balls at the same time.
Sure. I think what I'm actually thinking about is, it is my understanding that there is a pretty significant number of special education families who are currently receiving in-person services in their home schools. And they're doing that in small group sessions that happen during the day that would not be able to happen in the same fashion if school was back in session. And potentially that would mean that families who are, here we go. It would mean that families who are a little uncomfortable or very uncomfortable potentially, or flat out are unable to take the risk of having their child in regular school at these high risk levels, would potentially have to no longer receive those in-person small group services in the middle of the day on a schedule that is only available when their teachers are available to happen. Am I making sense? Am I generally?
I think so. Yeah, I think there would be some shifting of schedules. We do have IEP teams reconvening right now to consider homebound services for some students who, for whatever reason, are unable to physically come to school for services, but whose families are comfortable with 1 or 2 staff members coming to the home. So we're reconvening IEP teams as needed to discuss a continuum of placements for students, one of which would be to serve the student in their home for safety reasons. But for kids coming into the building, there might be some adjustments to schedules.
There is also a higher risk of both students and teachers being quarantined if we're back in person, which might also be a increased chance for disruption for special education services, would it not?
Correct. Yeah. I mean, and we're experiencing that currently where different individuals are needing to be in quarantine and we're adjusting how we deliver services. Some of that is shifting to virtual. In some cases, or some of the related service providers are still available to do in person. We do have families still having their child who might not need to be in quarantine to see like occupational therapists or speech therapists, and then receiving other services virtually if that educator is not available to do the in-person. So we've become adaptable and flexible and adjusting together with the family in response to the situation in which a student finds him or herself or the staff.
I think part of why I'm bringing this up is because I've, as a board member, received a couple of emails over the last couple of weeks with regards to special education services, in particular schools being affected by quarantine in a way that sounded to me like services were having to be significantly adjusted. And maybe that's what you mean by the flexibility and the fluidity of making changes to the way those services are provided. I'm better understanding what it means when I get an email like that in this, in this context, changing the way we provide all education.
Correct. In both of those recent situations in which we've had to adjust and pivot to more virtual service, we have had special ed and student services staff and test positive for COVID-19, and we have had students with IEPs also testing positives, and so we follow our contact tracing practices per the guidelines of the health department and quarantine and isolate individuals per the guidance of the health department and as needed for that individual situation. And sometimes we've had significant number of staff needing to be at home in quarantine because of that situation. So to not discontinue services, we are providing services virtually to the greatest extent possible, noting the extent to which services cannot be provided, so at a later date, the IEP team can consider compensatory services because of that.
I have a question. Thank you for all the hard work that's been put into this. It's amazing. It's kind of mind-numbing. What would be the timeline, the time frame, if this option was chosen? How long would it take to get this implemented? It sounds like it would take a long time.
Yeah, it would. It would take probably anywhere from about 6 to 8 weeks. And that's with going hardcore at it. That's with getting a survey out to families, getting time to get that survey back, collecting that data, and then taking a look at each of our schools and taking a look at the populations in each of our grade levels in those classrooms and that. And then obviously then having those discussions in terms of what teachers would go remote, what teachers would come in person, those types of things. So there's a lot of logistics to it that we would have to, turn around in a rather quick order. Like I said, generally we'd have the better part of roughly 3 months, 4 months, starting in the spring and going in through the summer to do all that. And here it would be a much more condensed version, especially determining what decisions the board does make with the holiday season coming up as well.
And my second question is, you gave us some nice data and research based on the HighFlex model and how it's not the challenges to that. Do you have any data or science related to this extended remote on its effectiveness?
So I mentioned earlier about Stevens Point. So Stevens Point is looking to go that route with extended remote. They will be starting that process on, I believe, this week, and then going through and doing that work and trying to get something in place after the Christmas break. In terms of any other hardcore research on that, there are some things out there with regards to it. Again, there's a lot of challenges, but a lot of that research that we have come across really focuses on the start of a school year rather than doing it in the middle part of the school year. So it's looking at kind of the option of saying, okay, here's where we're at. We're going to do in person, and then we got this extended remote piece. So there's not a lot in terms of doing it midstream.
Okay, thank you.
You're welcome.
And it essentially reshuffles the students, allowing families who want the face-to-face instruction to have that with a face-to-face instructor, while families who are not quite comfortable coming in person to stay in our current extended remote with other children whose families have chosen that with a teacher solely dedicated. So it's just kind of running two parallel models, so a face-to-face traditional option, and then an extended remote sections like we currently have.
Dan and John and Bridget, thank you all. Thank everyone who helped you guys out to put this presentation together. To me, this presentation is unrealistic. 6 to 8 weeks to implement it, it's totally unrealistic to anybody. That's just my personal feeling. And I know you put a lot of man hours and women hours into this, but that's a real unrealistic option one. That's realistic, obviously. Option two, with everything else that you put out there, it just doesn't seem realistic. I know we still got extracurriculars going on. We got Inspire going on, and special ed coming into the school. There's a lot of children right now in our community that are attending the schools in one way or another. Besides the people, the children that are doing virtual, and they don't get into any extracurriculars or anything like that. So for all of that and what's going on here, and the children's and the numbers are low for the student body and teachers. It's just unrealistic. You put a lot of hours into this. I know you did. I can see it in the presentation. I can hear it in your voice. And to me, it's unrealistic. It's just totally unrealistic to do it this way. Half remote, half virtual, half face-to-face, however you want to put it all together. It just doesn't seem realistic. 6 to 8 weeks to implement it, unrealistic in my book. We could talk all night about this. It doesn't make sense to even think about talking about this. After what you just put on, Dan, it doesn't make sense to talk about it. But I'm willing to listen to whatever anyone else has to say.
So the question, I think, Darren, you have some very good points. It's literally taking a school year, reshuffling it, but we normally start in April and May, get classes ready for September. It takes that long to develop. The question becomes, if the board were so to choose to bring students back above the burn rate above 350, there are many families that may not send their children to school because the burden rate is above 350, which was agreed to by the board. That's the big question that we have to resolve. And
I understand that, John. I understand that that's the parent's choice as a family to make the choice to send this kid to school or stay home. I totally understand that. You know, there's a lot of people that make choices in life. You know, so a lot of people homeschool, I know. You know, I'm just getting a lot of calls, personal and text messages that they want their kids back in school. Their kids are failing. They're getting truancy letters in the mail saying they're true from coming online and stuff like that, and getting tickets for $500 if they don't sign online and stuff. These are things that I'm hearing out there, and it's just unacceptable. So I stand by what I've always stand by. I stand by what I'm going to always vote. You know, I understand everyone has their own opinion, but I'm not here to play politics. I'm here for the kids and the education of our children for the city of Oak Creek. So,
John, Frank, so the option 2 is basically what we voted on a couple of weeks ago, is basically the ones that want to stay home, that feel that, you know, continue their remote learning, utilizing the iPad. That's basically it.
No, this is quite different than that.
Well, it's almost pretty much the same thing. But I mean, I hate to say, but to be honest with you, I mean, I agree. 6 to 8 weeks, it does seem a long time.
So to me, the biggest change I see is that you would not have a teacher doing both, whereas we had originally 2 weeks talked about a teacher would have their same class and kids could stay home or could come in and they would be teaching both. With this option, you were saying, based on previous data, having teachers try to teach both options at the same time is difficult. So families would still have an option of choosing one or the other, but then we would divide all the kids who want to stay home into one group and all the kids who want to be in school in another. And you'd have to kind of shuffle teachers to make sure those numbers were okay.
That is correct.
So my question is, if we're going to do it for the elementary, we should do it for middle school and high school too then. This is if we're going to think about doing this for elementary, then we should be doing it for the whole district. If it's going to take 6 to 8 weeks.
Can I ask, with the data that you've got about having one teacher teach kids at home and kids in person, is there data that is any different for middle or high school? And this is just my personal opinion. I do see more challenges for an elementary teacher teaching in person and virtual. Maybe I'm making some assumptions at the middle or the high school level where it might be presenting at the front of class about topics or things like that, or even the level of the children that are there. Is it easier to have a teacher be teaching dually at a middle or a high school level?
So basically what the research will tell you, the older the student is, the greater the opportunity for that type of model to work. Some school districts have done this at the high school only, the HyFlex approach. Some schools haven't. So what we've seen is that any school district that has done this HyFlex approach and has gone away from the elementary component has kept certain elements of it in the in the high school. Middle school is kind of, it's just kind of in the middle, right? It's just right there, and it's just kind of hard to, as we've been having conversations with both Megan and Sue in terms of what would be the best model and best approach for that. There's a lot of people on the fence on which way to go with that in terms of the rounding that we've done with their staff, the conversations we've had with them as well. So, but basically, the research that we've discovered with the middle school is that it would tend to move more towards this model than it would towards the HyFlex.
And another thing to remember that we talked about when we were together last time is we've observed anecdotally, while there isn't like a huge body of research on the best instructional model during COVID, you do know that some neighboring districts have had more success with their younger kids. Like they're able to endure in these models longer. Like large traditional high schools have struggled the most in terms of keeping their doors open. Like we're one of the 10 biggest high schools in the state of Wisconsin, and I think 8 of them are in a remote format right now. Arrowhead is open, I believe, at this point. I'm not 100% sure. And Kenosha is running at about 30% capacity. So, you don't want to create a model where we open and then 4 days later we're shut, and it just swings like that over and over and over again. So the team put this in front of you in the hopes that if the board was going to go down this avenue, like you guys talked about when you were last together, you'd want to do it with a group of students where we have a fighting chance of successfully reopening and remaining open. And what we've observed is at the younger the kids, the more cohorted the students, the more likely it is that if we were to invite them back in, even when our burden is approaching 2,000 in the community, that we'd actually be able to do it without open, close, applying that dashboard that Troy showed you, like in real time, constantly, like a roller coaster, right? So they wouldn't have put this in front of you if it wasn't, Oak Creek's experience right now is heavy, but you wouldn't want to do this if you didn't think it couldn't work, so.
I guess one question and maybe one comment. My question would be, if you looked at option 2, when does second semester start or third quarter? And is whatever that date is feasible as a break point?
Second semester, third quarter starts January 26th. So if the board were to make a decision, which way to go, if they were to select option 2, we would need to know sooner rather than later so that we could begin that work.
And I guess my comment would probably be, Frank, I'm thinking maybe with option 2, the reason that wouldn't work at a middle or a high school level would also be because you don't have one teacher who teaches everything. So if you tried to divide students into, it would be exponentially, I'm assuming, harder to have a group that is just with virtual teachers and a group that is just with in-person teachers. They also transfer teachers throughout the day.
It would be virtually impossible at the middle and high school because of student schedules and the different offerings that there would be. Why it would work at the elementary is that they're cohorted in with one teacher, whereas at the middle school they may have 7 teachers, high school they may have 7 different teachers, so it would be almost impossible to do at the high school to reshuffle and create all brand new schedules. It wouldn't work.
And then the other thing too that's worth mentioning is success, right? Success or our experience, like with our day camps, special education services, extracurriculars, right? Without a gigantic body of research to view, right? You find yourself in the situation where we're learning in real time all the time. Right? So if you were able to execute this model with our youngest learners, who we all agree that virtual learning is exponentially harder the younger the child, right? And less suited to serve the needs of young learners, right? But they're also cohorted together, and children under 10, the research has told us too, the health risks are different for students under 10. Right? We've heard that time and time again. It's just different for them. And if we were going to do something aggressive like this in a time of high burden rates, and we were going to try to do something that could have a chance of being successful, this would be the age group where the board might want to go down that road.
And Darren, I understand your comment that 6 to 8 weeks is a long period of time. I also think when you think about the surrounding schools who have made some decisions to pivot to virtual, that some of that is also due to the impending holidays, and that we have routinely seen an uptick in cases every time we're after a holiday and people have gotten together. And so we have Thanksgiving upcoming, and then we have Christmas and New Year's upcoming, which I anticipate some uptick in cases after each of those holidays as well.
Dang. There's a few members on the board that have children that play basketball. I believe your son or daughter is one of them. So you're okay to have your child go and play basketball and be within inches, even touching other players and doing whatnot, but you're still going to say close the schools? That's hypocritical to me. That's totally hypocritical. That's what irritates me about some people.
So, sorry. So Dan, you're saying by January 4th, so we voted today, it's 6 weeks.
Excuse me. I'm saying what we would need if we were to vote today, we would need the time up to January 26th to get things put together, survey staff, to survey parents, and to do all the re-rostering and working with HR to get teachers where they need to be and ready to go by January 26th.
And Frank, he isn't proposing like changing elementary students' teachers like prior to the semester.
No, I know, so really typically it's 9 to 10 weeks.
And the other component to this as well is that there would be a natural break with Edmentum, so there is a possibility that we may have some Edmentum students that may come out at semester time and may enter into this as well. So we have that data that we would need to take into consideration as well as we're looking at roughly 475 elementary students that are in Edmentum.
And then my question for Andy and Dan, is there any additional cost? How much is this cost?
No, this is sweat equity and man hours. Like, we don't have the ability to compel people to work over the holiday break or Thanksgiving, but it's the same as what you see in front of you. Like, the board has a discussion, like at our last board meeting, and I draw the team together and I say, this is the mission, and they do whatever it takes and they figure it out. Like, that's why you have all this stuff in front of you tonight, because it was required of us. So we did it. That's our job.
I've got a question, Dan.
Yeah.
On not the in-person question of it, but on the virtual side of it, is there any way that you could dedicate, say, because we don't know how many parents are going to elect to keep their kids virtual at this point.
Right.
But say if it was 10% or less, could you dedicate a certain amount of staff just to teach virtual only? That would be, say, a teacher for each grade. And combine all those virtual students into one virtual class rather than having virtual classes at every school.
Yes, Mark, that's what we're talking about doing is doing that shift in students. So no matter what the percent is of families wanting to return to face-to-face, we would staff that accordingly and group those kids into like sections, and whatever the percent is of families choosing virtual until the burden rate goes down to 350, we would reshuffle and staff and group accordingly. Okay. And so it would be kind of a win for families, no matter where they fall in their comfort level at this time.
And we're estimating dramatically more than 10%, however. Yeah.
If I could just keep on going with my thought process here, I guess, is I don't think our goal as a school board here is to let our kids in virtual for the rest of the year. I don't think that's our goal at all. But if it is, then we should concentrate on talking virtual schooling. We shouldn't be bouncing all over the place. But I don't think that's where anyone here wants to go. And I think in that scenario with virtual, we have to look at all the other problems associated with all the mental health of the kids, all of the physical well-being of the kids, and everything else that goes with it. So I don't think as a board, and I'm not speaking for everybody, I know myself, I don't want to go down that road, because the longer it goes on that way, I believe the worse it's going to be for the students, whether it's falling further behind in their education, whether it's added stress on the mental health of the kids and the parents. There's a lot of things involved in that. So myself, I'm not comfortable with remaining in virtual for the balance of the school year. I don't think that's an option for me personally, and I hope the rest of the board holds the same sentiment. So then you go to what do we want to aim here, or what goal do we want to reach as a school board, and how do we get there? And it goes back to, it's maybe not the right word to say, but doing nothing and leaving things the status quo, you're never going to get a solution or an alternative that's going to work. So, myself, I'm an advocate of going back to phase 2 with the option for the people that want to do the virtual course, if that's possible. But there's one sentence up there that I think really doesn't fall into the school board's job. Our job is to say, we want to keep our kids back in the school if that's our decision, but the school board will need to determine the date. I don't think we should determine the date. I think that should be left up to the superintendent and the rest of our staff, because they're the people that are doing the work on the ground. They understand what it's going to take to put things together and how long it's going to take and when the right time is going to be to implement the plan. So for us to say, well, we're going to give you 3 weeks to get it done, that's not fair to Dan, that's not fair to Andy, that's not fair to anybody else that works here. So I'm in favor of saying, let's go back to phase 2, but the date is to be determined by the superintendent after he gets all the ducks in a row and everything together. He comes back here and says, I've determined that we can go back to school January 7th or whatever day it is, and then we go on that. Then we vote on that. But for us to implement the day here and expect that all that work's going to get done, it may get done, but maybe it won't get done. And then we'll be back here talking again because we're not ready. And I don't want Dan to implement a plan that he's not comfortable with because he didn't have enough time. So that's pretty much where I'm going. I'd like to see us get the kids back to school in a phase 2, but the date and the plan should be done by the people that are doing the work on the ground. It shouldn't be determined by us.
You mean option 2?
Yep, option 2.
The challenge we're wrestling with at this point is that the board has adopted the burden numbers, and families have made decisions related to those numbers, right? So we're at our meeting last time we were all together. There's discussion about I think there was a motion on the floor that got voted down to return to school really quickly. And then there was a discussion about elementary school continuing. Then a couple people made the comment that they're not necessarily married to the 350 burden. So we fielded some calls from some people throughout the community. And like the reality is that we have a number of people here who made decisions based on that number. Right? So we have to find a way to create a way forward for those families who made choices based on that 350 number that the board voted on. Is there any way we could turn our mics off if we're not speaking? So the challenge for the team was we're trying to meet these varied needs of different people and respond to the different requests and demands of the board. Right? So we're trying to create a way forward. So a family that said, I will go back to school based on the criteria that the board has adopted, that the board will now alter, right, still has a way to feel comfortable, right? So we talked about HyFlex the last time we were here, before we even really knew that new term, right, that iPad streaming option, right? So the team investigates it, explores, realizes that the logistics of HyFlex might work well for someone who is quarantined or for a short period of time, but the instructional model isn't something you can run parallel, right? So if, just say, Mark, we said it was semester time, like that's how you could get an elementary student re-rostered, switch their teachers, it lines up logistically, right? If you were going to target that for semester, like if we just said we're going to go back into phase 2 at semester regardless of the burden rate, what we were confronted with is there's probably several hundred families for whom that will not be an acceptable scenario. Right? You've heard from some of them come and speak, some of them emailed. Some people would be overjoyed that their kids got to go back to school. But then we'd be faced with the logistics of quarantines aren't going to go away, and quarantines of what knocked us down before, right? So Troy presented that scenario. So it's just, there's a bunch of different plates in the air at once. If we were going to survey all of our elementary families and then re-roster all those kids based on family preferences. Like, I don't have a crystal ball, but I would assume that our burden rate will still be over 1,000 when we get to January 22nd. It just seems to me that it goes down more slowly than it shoots up. And we're almost at 2,000 right now. We have Thanksgiving, then we have the holidays, right? It's going to take a little while. And I've asked repeatedly, you all know me, like I'm an optimist. I've looked for rays of hope everywhere I could possibly find them, every rock I could look under. And I ask the health department or the health officers on our call that we have each week, when can I anticipate some good news? When do you think this is going to get better? And for a little while, they said, the sky's the limit in terms for how high burden could go. And then you've heard people say, well, after the holidays, you could see some improvement. So I've heard this board say before that they'd look to make a change regardless of where the burden might be when we got some good public health news. So if you mix all those elements into a pot together, right, it's a stew of challenges. So the team brought together this idea for you where if you think you want to send kids back into school, even with a high burden rate, we have to accommodate the parents who will be uncomfortable in that scenario. You target, if you're going to change people's teachers, you'd want to line that up with a quarter to make the most sense for grades and instructional continuity and a variety of other reasons. Plus, you'd need a minute to be able to do it. So hence what Dan brought forward for you, right? So if you're going to deviate from the metrics that Darcy presented that we adopted from the Milwaukee County health officers, we just felt we had to present people with options if we were going to switch that guidance midstream, because people may have planned their lives around what you all voted on and chose.
I do think though we had talked about that and making it a school by school dashboard decision versus an all or nothing. So I'm just curious to see why we're not talking about that now.
You are, Amy. That scenario that Troy showed you, that applies to each individual site, right? So if you did this and you have one virtual section and two face-to-face sections in third grade over at Carrollton, and we didn't have the staff to run it based on the dashboard Troy showed you, we'd close that site, right? Or at a different school or a different grade level. Right, the complexity of this is pretty intense, right? So semester rolls around, burden in Oak Creek is 1,000, 2,000, 3,000, but we've surveyed everybody, we've re-rostered, the board told us, do this, right? We still might end up in a situation where we're open for a few days and then we don't have the staff to run. Right, we just have to be clear-eyed about the possibility that that could very well happen. You know, you see that play out not just in Oak Creek, but throughout other communities. So just say the board said, all right, we want you to go down this road. Right? Spend the next 6 weeks figuring out, or spend the time when you have your staff available between now and whenever that may be. Semester makes sense for a lot of reasons. Surveying all your elementary families, re-rostering everyone, figuring out which teachers are going to teach all the various sections, right? And then we go back at semester for elementary kids. They might be open a couple of days, or they might not even be able to open because of staffing challenges. That's a very real possibility. Now, you saw how creative our principals and human resources and Bridget can be in terms of figuring out how to patch a building together to be able to move forward, and what team players everybody is, but there's still that 5 unstaffed line for elementary schools that we very well might cross. I think when the board voted on the criteria initially, where that burden limit was 100, nobody ever thought it'd be 1,900. Right? I don't even think the health officers thought it would be 1,900 when they gave you 100, and then they updated it to 350. And who's to say we won't see more updated information? Like, you go to the CDC's website now, they still have their same limits put on there that they've had on before, and I haven't seen them update them yet, and who knows in terms of state or federal action, but we're willing to push forward to try to figure something out.
Dan, the other question is send that survey out to parents. I'm curious how they would appreciate that their kids might be moved to a different school and have different teachers, and I don't know.
Nobody's going to like that.
Exactly.
You got to understand, people are not going to like this.
I can just think of like special ed and all that. I don't think special ed, that'd be, I know that wouldn't go well because they have such a great relationship.
This solves one problem, right?
No, I know, I'm just bringing it up.
Yeah, no, like we thought of that. That's why it was in the PowerPoint, right? Because here's the deal. Like, you solve one riddle, which is we want our kids back in school, but we have a finite number of staff. So there's all these different downriver issues that it would have to be solved, including your second grader might have a new teacher at the semester, or your third grader who signed up for virtual might have a virtual instructor who operates out of a different building. Like, this is not an easy lift. This is exceptionally complex.
I have a question, actually, and it's about this idea that extended remote teachers would continue to teach a student when they moved into their home school. I don't understand that. How would that even be possible? Because what I'm hearing, so tell me where I'm getting this wrong. What I'm hearing is that we could potentially cohort virtual students based on grade level, and then give them an extended virtual teacher. Are we saying that we would move the in-person kids around and that they're the ones that would move schools, or are we, because how, if you're cohorted with students from 2 different schools with a single extended learning teacher, how do you continue with the same teacher if you're sent back to your home school? I'm missing that part.
So what we would be looking at there is we'd also have to take in consideration what effect Edmentum would have with this as well. So Edmentum could play a very important role in terms of how the staffing would play out with the scenario that you had shared with us. So we would have to take a look at that balance between schools and the students moving out of that cohort and into a remote situation and then coming back, hopefully that we're not separating them between 2 sites. So again, it's doing all of that to try to balance all of that.
You make every effort to avoid having kids who are not taught by a teacher in their home school. Like, you do everything you can to avoid that. But the reality is we don't know how the numbers are going to come back, right? Like, people might feel very different when the burden rate is 2,000, right? And the national news and the local news is difficult to watch than they did earlier in the year when they made different selections, right? So we figure you got 1,900 elementary students. What if 1,000 of them want to stay in remote until we hit 350, like the board originally put in place?
Absolutely. No, I absolutely understood and assumed everything that you just said. But in writing on option 2 is that extended learning students will go back to their home school and stay with their same teacher. And it sounds to me like we couldn't promise that without having done a survey and actually knowing what's going on. And so for us to vote that that's the case doesn't actually seem like we can promise that right now. And I just would rather not make promises we can't keep.
No, I understand. And to Frank's earlier point, this isn't a rose parade presentation here. You know, it demonstrates like everybody on the team's absolute best efforts to put something viable in front of all of you that reflected your discussion at our last meeting.
Can I chime in a little bit? I guess what I'm kind of listening to here is everyone's afraid to pull the trigger because for whatever reason. So I'm looking at it this way, and really I don't want to do it, but you know, if everyone's concerned about burden rates and stuff, I kind of broke it down on what should drive our decision first of all, and I looked at, you know, 3 different things. You look at the county rate, the city rate, and what we actually have with the school population and the teachers, which I think the driving force should be the school end of it, and it should weigh more into our decision than the county or the city rate, because we're dealing with apples and oranges. You know, you're dealing with the population at large, city or county, and we're just in a smaller group of people with the student body and the teachers. That being said, I go back to a comment that was made by one of the presenters, parents, that, you know, we don't live in a bubble, but, you know, we're trying to keep everyone in a bubble. And, you know, if we're looking at a burden rate of 350, whether it's with the city or county, before everyone's comfortable with pulling the trigger on this stuff, then we should be talking virtual again, because that's the only option out there, because for all intents and purposes, the burn rate might get to 350 until Easter time. Maybe it won't get there till May. So why are we wasting our time talking about it? We might as well just say we're staying in virtual for as long as it takes, and when the burden rate gets to 350, then we'll talk about sending the kids back to school. Cut the conversation short. Let's go home and forget about it until the burden rate gets to 350. Then we can come back and talk about it. Otherwise, we're just wasting time here. Keep everyone in virtual until it gets to 350 and forget about it. I don't want to do it that way, but everyone here is not going to come to consensus with putting kids back in school. I can see it until the burden rate is X. So whatever the burden rate you decide on, whether it's 350, 550, 750, 850, we can quit talking about all this stuff until the burden rate gets to that number. Then we come back and we have a discussion about sending the kids back to school and forget all this mess. That's the best way to settle the hash right here. You know, everyone tell me what burn rate you want. You know, for me, I'm willing to take a chance and get kids back in school and try something, because if we don't try something, we're not going anywhere. But if everyone wants to stay with a low burden rate, then we stay virtual and stay virtual until the burden rate gets where you're comfortable, and then we talk about going back to school. But why are we wasting time here if for all intents and purposes, nobody's ready to pull the trigger anyway? That being said, I'm ready to end the discussion. Don't put any motion on the board. Just stay the way we're going until the till the burden rate gets to whatever number, what everyone decides on, whether it's 550, 650, 750, you come up with a number, I'm happy with it. But I refuse to sit here and keep talking about something that ain't gonna happen.
Exactly.
So Dan, can I ask a question? The last meeting, you were talking about that, you said it would be for just a short interim time of using the people that want, the kids wanting to stay home, parents want the kids to stay home, utilizing iPad like a quarantine, right?
Mm-hmm.
You did say that would be good for a short interim time.
We've used it for students in quarantine.
Yeah.
Right, so a couple weeks. Yep.
Could that last a month and a half? Way?
The reason this whole different scenario was put in front of you is because the research on long-term use of HyFlex,
I know.
it's not a sound long-term plan.
It's too bad that we can't do that, kind of like Mark's point, in utilizing that to get through the holidays, and then so the kids that want to go back to school can.
Well, at some point, to Mark's point, the numbers improve, and I don't know if it's 350, right? And I can't look into the future. Like, I don't know when it's going to get lower, when it's going to start to turn down, but I do think that the board isn't going to choose not to discuss it when it finally starts to turn down. I think the room has said before that they want some good public health news, and that's when the comments about being married to 350 were made the last time. And there's at least 3 of you who are certainly are not committed to the 350 number, right? So So at some point, the board's going to revisit this, and in my opinion, just listening to all of you speak, it's going to be well before we get to 350, right? So we were thinking of things that could accommodate the parents who would be uncomfortable with that, right? Because we realize that this room, there's at least 3 of you who aren't particularly concerned with 350, and there's a number of other individuals who are just looking for some good public health news to do some other things. And I could be very wrong, and correct me if I'm wrong.
That's why I put the scenario out there. Give me, for the people that ain't comfortable sending the kids back to school at whether it's 1,000 or 1,500 or tell me a number. I'm glad to entertain any number that you're happy with, whether it's 550, 750, 450. Give me a number and then we'll come back and talk about it. Because I'm not going to keep pushing a chain here knowing that I'm not going to get any support. You know, just tell me what number you're comfortable with, Cheryl or Leah or anybody, or Amy. Just tell me a number you're comfortable with.
Can I talk?
Well, I think this,
If you be quiet, then we
I'm
can
waiting for you to say something.
Well,
Could I just please request that here at a public meeting, we don't yell at one another and we take turns talking? I know it's late and I know everyone's tired, but can we please just take turns?
so Cheryl, could I just chime in real quick? So I think to Mark's point, the option 2 that Mr. Thielen presented kind of slightly takes picking that number, Mark, off the table, and it allows at a date to be determined by administration. So let's say the start of second semester, for us to open the schools to families who are comfortable no matter what the burden rate is. And that for those families who prefer 350 or lower to stay remote. So we wouldn't have to have future discussions about when do we as a board feel comfortable having kids come back, like what is that burden rate? But this plan, no matter what the burden rate is, would allow families to choose to come back in person, where others could stay. So, you know, we wouldn't have to have that dialogue about where is our comfort when it comes to burden rate. It would be the choice of the families. And that the binding criteria at 350 would remain, and once below that, per your binding criteria that you determined as a board, everybody would return face to face.
can I?
Right.
I know we talk about, would give families the option. What was the discussion with staff? How comfortable would staff feel with something like this if our burden was significantly above 350 and we were doing something like this?
I can answer that. Working with the elementary, principals and elementary teacher, we have a workload committee. They are very uncomfortable with the burden rate being where it's currently at for a lot of different reasons that families, parents spoke to this evening. Students may be asymptomatic. They may be carrying it, not knowing it, and infecting our staff. And we know that schools could close as quickly as they open. So there's concern on the high rates that currently are in Oak Creek. And then to Mark's point, Mark, the number, I mean, I don't know, but the binding criteria is 350, and I understand the frustration amongst all of us, because we all want what's best for kids, and that's to get our kids back into school. But at what point do we do it in a safe manner where we're not going to open and close schools on a continuous basis? That's going to do more harm and break up the continuity and consistency that we currently have with remote learning. At least one thing for certain is that those relationships, although it's not the same as in person, are still being built through remote learning. I think if we had to reshuffle the deck, I think that would be disruptive to the social emotional needs of students. It's not an ideal option, but it was an option that was asked of this team to put together, and that's what we did. We put our best effort forward. As you said, we spent many nights and weekends going through this and putting it together to come up with a comprehensive plan. Is it ideal? Absolutely not, but it's an option, and it's up to the board to decide whether we're going to go with option one or stick with option one with the binding criteria of 350, or just disrupt the system with option two, knowing that it's not ideal, but it does resolve one issue, and that's getting some students back into school that do want to go.
John, that was, excuse me, Frank, but to your comments, that's why I said the sentence in there, the school board will determine the date. That's why I said we should have you guys determine the date, because you're the people that got a handle on this thing on the ground. We don't.
I don't know that we have a handle on it. Nobody has a handle on a burn rate of 1,800.
I'm not talking about burn rate, because we're talking about 350 as a general statement in option two. So that puts the decision making onto the school superintendent and the people that are dealing with the situation on the ground, not the school board. We can tell you guys that we want you to put the kids back in school, but it's up to you guys to determine when it's safe. Because you're already putting it out there that you're willing to go above 350. That's what I said before, and maybe I got a little loud, but that's what I said before. If it's above 350, what's everyone comfortable with? 450, 550, 750, 1,000? Because if you're not just willing to take the blanket statement on option two and forget about the burden rate, no matter what the number is, then you have to establish another number where everyone's comfortable. That was my point. So what's the number going to be? Is it going to be 550, 750, 1,000? What's it going to be?
Yeah, John,
and until we find out what everyone's happy with, we're just wasting our time here. Stay with virtual.
Yeah, John, you stated that you had talks with the teachers and stuff, and they're not comfortable with the burden rate. Do you know what burden rate they would be comfortable with to bring the children back into school? Like Mark said, they're the ones that are there in the trenches on the ground. They're the ones dealing with the children face to face if they go back. Did they give you any kind of number that they would be comfortable with so we can get these schools back open? Because you're talking to them, you're telling us now that they're not comfortable with that burden rate. So what number were they comfortable with?
I think that the comfort level would be based on what the medical professionals have recommended and what the board.
That goes both ways, John, because medical, they're saying put the kids back in school for mental health and their physical well-being, and then the other side is saying, oh no, keep them home. So that's not a correct answer, because it goes both ways there. If you understand what I'm saying, that's true. It's out there. So we need to know a number, or like Mark said, you throw the number out and then let the school administration make that decision when the children come face to face.
I've heard people say that or share that when we received some good public health news in this room, like we were a couple of weeks ago, and I heard that stated that when we see some sort of indication that there's a plateau or a downturn that lasts a week or two, right? Anything good that doesn't indicate just vertical, exponential, continued issues that will make it hard for us to staff, because the more COVID there is in the community, the more likely it is that we're going to have a great deal of quarantine issues. I think that's just the practical wrinkle of it, regardless of how you feel about any of the other issues. Like the more COVID that's circulating, the more difficult it'll be to staff because of all these quarantines. That's what you see, you know?
If I may add, if we choose anything other than 100, 200, or 350, we are just picking a number out of thin air, because all of those numbers have come from some sort of high-level medical authority who understands COVID greater than all of us together. So for us to pick a number different than that, we could pick anything, and it's just shooting fish in a barrel and hoping one of them floats to the top. I think that the choice here, as I'm listening to it, is the board willing to put children in the school with a burden rate higher than 350? And if they are, this provides an option for the families that want to attend, burden rate aside, and provides an option for those families who made a decision at 350 that I would send my child to school if it was lower than that, but if it's not lower than that, I wanted them to be remote. Option 2, take the date out aside, provides that option. The lead time that Dan provided, Dan Thielen, is simply the time it's going to take us to get from A to B, which is where we are today, get students across here, get them in the appropriate piece, communicate with families to understand that. Darren asked a question earlier, what rate are teachers going to be okay with? They're going to be just like us. Some of us are going to say, send your kids to school, or send our kids to school because we think that they need the face-to-face learning. Some of us in here are going, there's no way in heck I'm going to send my child to school until it's below such and such a number. And some of us are like, we would like, as Dan provided, to see some downturn. We're going to find that all over the board. And we have 430 some teachers, and they're going to be spread across the board. And so we have to take that piece out of consideration and really go with, how are we going to meet the needs of families that want to participate face-to-face? How are we going to then provide for families that made their decision based on 350? And how are we going to continue virtual for the students that, or the families that made their decision way back in August at 100? Because we still have those families that exist. And so, to the point I'm trying to make, is choosing anything other than 100, 200, or 350 is just an arbitrary number, so we could say anything and call it a day. But the plan that was provided from the curriculum team provides us an avenue to do the only thing we're not doing, which is provide face-to-face education for families that want face-to-face education.
So Dan, Dylan, Bridget, a couple questions. One, I kind of lost my thought here, but I apologize. You said January 26th is semester, right?
Okay. That's the start of third quarter, second semester.
So is there a way, if a parent's not happy, because I can just think like special ed, and maybe other students that the parents don't want say they pick extended remote, and they don't want to change their teacher. Is there a way to opt out of that? You know, an option that, you know, because I think like special ed, that's never going to work. I mean, because they have such a phenomenal relationship, right? That collaboration between the student, between the learner and the teacher, right? Or, you know, whatever the scenario is, can there be an option where they can stay with their teacher? That's one. And then two, is there a way to update that, move that date up, like say a week or two? Just curious. It's just a question, but.
So I'll answer the second question first. To move the date up, it would all be dependent on the survey, getting the results of that survey back, and then putting the wheels in motion to do the re-rostering and so on. So once we get into the work, we'll have a better idea in terms of being able to see if we can move up that date. I know that if we were to look to do a clean break at semester time, January 26th would be it, especially with Edmentum.
It just gets to Dan's point too, like it's, you know, it'd be hard to switch a kid's classroom teacher, right, in the middle of second quarter.
Right.
It would align with grading purposes as well.
Right. And then the second question about the option of trying to stay with a teacher, again, that's something we could take a look at, depending on how the numbers play out. That's going to be tough to say for all kids that may come of that, but we can work with the team to see if there is a possibility of making that happen. I don't know. It's just going to take some time if we go that route to take a look at that to see what kind of decisions we'd have to make based on the numbers of students that would want to go with the extended remote and then going from there.
So to the board, I'm just saying, kind of like what Mark was saying is, we're going to keep extending this could go on for months, right? If you guys feel comfortable above the 350 and we go with option 2, at least, okay, for elementary wise, January 26th or whatever you said, or possibly earlier, I'm crossing my fingers. But if it happened January 26th, at least we have something in concrete that we know that parents will know that they can make a choice. Correct? So that's depending on how the board feels about that, but at least we have something, again, I'm piggybacking what Mark said. We have something down. And my only question is, what is the plan for middle school and high school then after that? But that's a whole nother different discussion, but not for today. But that's something that we definitely need to talk about because we need a plan for them too, so.
Frank, could I?
Yeah, go ahead.
A little bit. Well, I'm still not comfortable with the highlighted sentence there where the school board will need to determine a date. I think that should be amended to say superintendent determines the date.
Yeah.
But I'm willing to put a motion out there that we adopt option 2 with the change to the highlighted sentence that the return to school date would be determined by the superintendent.
Mark. Mark, real quick. How about going hybrid for middle school and high school on the date that the school superintendent picks also? So we get.
I don't want to muddle the water with all kinds of extra work for these people. They got enough to do already. Just concentrate on one thing and we get that going and we'll do something else. And as it was said before, Darren, that the older the kids get, the easier it is for them to handle the virtual learning. So, I mean, it's not the best option for high school.
I'm going to put this on second your motion.
So you have a motion, what?
Yes, to adopt option 2 for the elementary schools, but change the sentence that instead of the board will need to determine the date, that the superintendent determines the date.
Yeah, I will note that the room has talked at length about the alignment with semester, right? So as I understand it at that point, like that is, can you hear me?
Yeah, January 26th.
Right. The semester is the logical aligned point, right? So I'll just say that for the record for the room, as if Mark's motion stands as it is, like given what Mr. Thielen has presented and all the attendant logistics, and that we'd be targeting the semester.
Mark, Darren, did you second that?
Yes, I'll second it. The kids will be out of school for a half a year, but that's all right. At least we got a date set by the superintendent, which is probably going to be the 26th of January, and at least the people of Oak Creek and the families know there's a date that they're going to be coming back. So I second that motion.
Any discussion?
Yeah, actually. Go ahead, Cheryl.
I struggle. You're muted, Cheryl.
You're muted.
I struggle mightily with the fact that we are, with this proposal that's on the board, this motion, we are going against all science and data. Our burden rate could still be, I mean, and we say it there, depending on, whatever the superintendent decides or whatever. I feel like we're not looking at what the CDC recommends. I mean, all these things we've had before us that we've talked forever about, we don't have we don't have we don't meet any of the criteria that the CDC talks about. They talk about over 200 is shutting down. We are well over that. Positivity rate is well over that. We can't contact trace appropriately. Hospitals are near, capacity. Staff in hospitals are overwhelmed. Staff in our buildings are overwhelmed. I can't go along with this. Not at this point.
Well, like I said before, it goes both ways. You're watching one news media outlet, one scientific or whatever outlet. I'm watching another. I'm hearing it both ways. Both ways. Yes, I know the numbers are high. I understand that. But it's coming both ways. The children should be in school for mental health and physical reasons, and then the children should not be. The numbers are so high. So I understand where you're coming from 100%. There's two sides of that story.
There's not two sides to what the CDC has proposed. I've heard a lot of people say that the CDC is saying that kids should be in school. Of course they should be in school. Yeah. Dr. Fauci says kids should be in school for their mental and physical health. Definitely. That is also true. But the fact of the matter is that the CDC also says that you have to be acutely aware of your community burden rate in order to determine whether being in school is actually safe. Now, yes, it is probably just as safe for most kids to be at home as it is for them to be in school. I mean, that's what the CDC is basically saying, because kids are not more likely to get it at school than they are in the normal community, which is why they want you to use the community burden rate, because the community burden rate tells you the likelihood of infection in children just as well as anything. The problem is that we have a very high community burden rate that is way past what the CDC says is highest possible rate of infection. We are at 900% of what the CDC says is highest possible rate of infection. So yeah, the CDC says kids should be in school. The CDC also says local governments should watch their community burden rates very closely to determine whether in-person instruction is going to be sustainable and feasible for the community.
I guess to that statement, Leah, then you're recommending that we go and wait till the burden rate gets below 350. Like we had before. We may wait till past the end of the school year. So then, to my point that I said before, then why are we discussing anything about this until the burden rate gets to 350? Just stay virtual until that point comes, and then we'll have the discussion again. And what I said before, if that's the number you guys want to stick with, that's the number we're going to go with. So why are we wasting everybody's time here continuing to talk about any other option if you're fixed on 350? Because if 350 is the number, then we don't talk about this anymore until it hits 350. Case closed, correct?
I would just love to see, as Dan has said several times tonight.
Amy, I'm sorry, go ahead.
Yeah, thanks. As Dan has said several times tonight, I think we would all like to see the numbers start to go down throughout our community. And until that happens, and there's some significant downturn in the numbers, I am not willing to accept this plan.
Okay, any other discussion?
No, just, you don't accept the plan, but it's okay for Aspire to keep running. It's okay for extracurricular activities to keep running. Okay, we don't hear nothing about them shutting down. Besides, I think it was Cedar Hills, they had to shut down the school or something for special ed. But I don't understand. You're okay with all that to go on with these children, but you're not okay to open the elementary schools because of the numbers? That doesn't make sense to me. And a lot of people in this community feel the same way. If you can't open the schools because of that, then you need to shut everything down. Extracurriculars, Inspire, shut it all down then. If you're so worried about the number being 800, 900, shut it
Can
all
the
down.
president of the board please take control of the meeting? I do not think it's appropriate to have board members yelling at other board members in the middle of a public meeting.
I don't think he's yelling. He's just talking about what he's saying.
No, he's yelling.
Well, Darren, don't yell, okay?
That's my voice. That's how I project myself. That's my voice. I'm sorry. Let me move my computer a little bit farther away. There. Thank you. I said what I had to say.
Okay, thank you. Okay, we'll take a roll call, Jane.
No.
Cheryl?
For the safety of my community, students, and staff, I vote no.
Darren?
I vote yes.
Amy?
No.
Leah?
No.
Mark?
Yes.
And I'm yes also. But the only thing I have to say to the board is we have to think about a plan. Parents were asking, so.
We have a plan.
Not really.
We have a plan.
So it seems to me we're done till 3:50, so.
You keep saying that, but you're the only one saying that.
Leah, but option two, we just,
Guys, I
option
think
two,
we
we
need
just
to
sat
vote.
down, said the number above 350. It didn't set any number in stone. It didn't etch it in stone at 3,000, 5,000, 400. It just says the burden rate above 350 as a general statement. That's what we just voted on. You guys voted it down. And I asked that the superintendent determine when the decision. So you guys just shot down option two, which said above 350, which means you're not happy with anything above 350. So now we're at 350. So end of discussion. We're done talking about it until it gets 350. Because you just shot down any number that was above 350 with option two.
No, we didn't. We shut down.
Yes, you did.
Guys, we already voted.
We should have another motion before discussion would continue.
Correct.
This motion was voted on.
Yeah, it's already done. I mean, if there's another motion, if not, we go on to number 11. Any other motions?
I motion that we raise the burden rate to 650.
Anybody going to second that? So if there's no second, Dan, that fails, right?
Fails.
Yeah, so there's going to be no school this year. I can see it already. Doesn't take a scientist to tell you that, girls and guys. I'm telling you, it's tough. It's going to be tough for these. I know we can't talk about it. I'm done.
Okay, number 11, review upcoming school board agenda. Any agendas?
Okay. Weather changes come back. Mr. Holler will come for an update. We'll have a science social studies adoption from Mr. Krenick. That'll come back around again. We'll also do emergency care guidelines, open enrollment limits for the year. Andy will share with us. We'll do the WASB delegate assembly resolutions and the November budget report, all coming up. Those are the things for sure. There might be some other things added as we go by, but those are the things we're definitely going to see again.
Okay, you have a motion to adjourn?
Siniglia moves to adjourn.
Malat second.
Any discussion? All in favor, say aye.
Aye.
Aye. Opposed, say nay. Thank you for everyone attending.
Happy Thanksgiving.
Really?